order this meeting of the Sacramento County Board of Supervisors for Tuesday, March 10th, 2020. Madam Clerk, will you please call the roll and establish a quorum?
Supervisors Frost.
Here.
Kennedy.
Here.
Natoli.
Here.
Peters.
Here.
Cerna.
Here.
You have a quorum.
Thank you. Would you like to read our statement?
This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. The meeting is closed captioned and is webcast at sacramentocabletv.tv. Today's meeting will be repeated Friday, March 13th at 6 p.m. on Channel 14. This meeting is also broadcast live on KUBU Radio on 96.5 FM. A DVD copy is available for checkout from any local library branch. Members of the audience wishing to address the board may fill out a speaker slip and hand it to staff. When the chair calls your name, please come to the podium. Also, please silence your electronic devices at this time.
Great, thank you. If you'd please all rise and join me in the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, good morning to everyone that's joined us today here in Chambers. Again, as a friendly reminder, if you choose to address the board on any matter that's on our agenda or off our agenda, you're certainly welcome to do so. We ask that you keep your comments to 3 minutes, and we have that time limit in place so everyone has an opportunity to address us if they so choose. We do have staff at the back of Chambers that can help you complete a speaker slip. We ask that you please complete that, and if you would, especially for the chair, if you would print your name so I can accurately pronounce your name when I call you to the podium, that would be great. Please give those speaker slips to our clerk, and you'll be called in the order that I received those slips. We do ask respectfully that you please refrain from using profanity to the best of your ability. These proceedings are watched live, and they are recorded, and we know that a number of young people in our community watch these proceedings as a matter of their, in the course of understanding civics and political science and the government here. So we want to make sure that we use appropriate language in these chambers. Okay, with that, our first order of business, please.
Okay, so for your consent matters, items 1 through 25. I do have a note to hold item 7 as the last afternoon item, so that would be after item 36. This would be the contract to approve the Second Amendment to the agreement with Stantec Architecture for professional design services on North Area Recovery Station, the Master Plan Improvements Phase 1.
Okay, so we take that after 36?
Yeah, so 36 is your last timed item for the afternoon.
Okay.
The request is the nature is that this has something to do with solid waste rates, and that once we do the rates, and then the board should look at it to do this contract or not.
Correct. Okay. All right. Any member of the board wish to pull something off of consent for separate discussion or vote, or to make comments? Supervisor Peters.
Thank you. I'd like the record to reflect I'm going to recuse from item 4, potential conflict of interest.
Okay.
Any others? No. Okay. All right. Please let the record show that Supervisor Peters is recusing from consent item number 4. Is there a motion to approve consent?
So moved.
Second.
Moved by Supervisor Natoli, seconded by Supervisor Frost. Please vote.
Unanimous vote.
Okay, very good. Thank you. Next item, please.
Okay. For your first timed item, your presentation is the presentation of resolution honoring Penny Miller upon the occasion of her retirement from the County of Sacramento.
Okay. Very good. Why don't you join me at the podium, please? Okay. Good morning.
Good morning.
So it's my distinct honor this morning to be in front of the board and the public here. And I'm not sure if you brought any family members or if you have any friends in the audience. You have a photographer too, I see that. But as we do very frequently in these chambers, we are honoring someone that has given of themselves an entire career to the public service of the residents of Sacramento County. In this case, we are honoring the retirement of Penny Miller, who has been with Sacramento County's assessor's office for 36 years. Is that right? That's correct. Wow, 36 years doing anything is impressive. She earned a Bachelor's of Science degree in Agricultural Economics and Business Management from the University of California, Davis. She began her distinguished career with the County of Sacramento on November 7th, 1983, as an assistant property appraiser in the assessor's office. On November 25th, 1984, Penny promoted to real property appraiser. While working at the assessor's office, she earned her Board of Equalization certification for real property appraiser for property tax purposes and her certified general license for appraisal in the state of California. She promoted to associate real property appraiser in July 1989, and in March 1990 promoted to senior real property appraiser. These are all, by the way, these are all the whereases in this resolution we're about to present to you. I'm going to go ahead and skip to the resolve here. Now, therefore, be it resolved that the Board of Supervisors, County of Sacramento, State of California, does hereby congratulate Penny Miller upon the occasion of her retirement and extends its appreciation for her many years of dedicated service and further wishes her much happiness in the years ahead. And the podium is yours. Congratulations.
Thank you very much.
I want to say a few remarks.
I just want to say thank you very much. It's been a very long and rewarding career with Sacramento County, and I enjoyed it very much. Thank you.
Very good. Thank you.
Thank you.
You want to go ahead and call the next item, unless there's comments by any board members?
No, I was just curious, what do you plan to do in retirement, Penny? 36 years of doing this, what do you plan to do in retirement?
Well, I'm on to the next chapter, which is have lots of fun.
Okay, very good. Well, we wish you well.
All right, very good.
Okay. Item 27 is the presentation of resolution recognizing March 2020 as National Social Worker Month.
Okay. I think we have some executive staff that are going to join us at the podium here. We have Michelle Calles and Ann Edwards that are going to accept this resolution. Again, members of the board and the public, this is a resolution from the Board of Supervisors recognizing March 2020 as National Social Worker Month. I'm not going to read all the whereases, but I will say that I think everyone up on this dais has a very, very strong respect for the work that our social workers do here for the residents of Sacramento County. I know many of us have done ride-alongs and seen for ourselves day in and day out what they do for the folks here that we represent, and it's a distinct pleasure as chair of the board this year to present this resolution to Ann and to Michelle, recognizing March as National Social Worker Month, and then I would invite you to say a few words if you'd like.
Thank you, Supervisor Cerna. Good morning. Michelle Callejas, Director, Child, Family, and Adult Services. And just some context. So this month was organized as National Social Worker Month back in '63 as a way to encourage public support for the profession of social work. And then in 1984, there was a joint resolution signed in Congress, and President Reagan declared March as National Social Worker Month. And Ann and I spoke a few months ago and said, let's do a recognition before our board for our extraordinary social workers in Department of Human Assistance and Child, Family, and Adult Services. And from Child and Family and Adult Services, I think you all know the role many of our social workers play They are in our community each and every day, attending to the safety and well-being of children, families, dependent adults, and older adults. They provide services and support with excellence, they serve with integrity, and they provide services that allow individuals to live with dignity and respect in least restrictive settings. The work they do is honorable and noble, and for today and this month, we elevate them and recognize their work. So Ann wants to say a couple of words as well.
Just a few words. Good morning, Ann Edwards, Department of Human Assistance. First, I want to say ditto to everything Michelle said. The social workers in the Department of Human Assistance provide a wide variety of functions. They serve the homeless. They help folks that are trying to find work so that they can get off of assistance. They just do so very much. And as Michelle said, it is really noble. It's really hard work because you're dealing with people who sometimes are at the lowest place they are in their lives, and you have to be present and engaged, and it can take an emotional toll on social workers. So I'm so very proud of the work that they do each and every day. And we would like to invite the social workers and their supervisors who are here to just stand, please. So very much. Thank you. All right.
Great, thanks again.
Thanks, Dahl.
Okay, we have a number of other morning matters. I am in receipt of 2 speaker slips for off agenda, and I think instead of having people wait, I would like to invite the 2 off agenda speakers to address the board, and then we can move on with our morning agenda. So first is Dan Adderholt.
Morning, Phil Cerna, Board of Supervisors.
Morning.
Morning, Dad.
I'm here this morning. Last time you guys saw me, the last meeting I was here about the 25 feet from the water, American River. And we were misinformed, so I apologize. I was kind of irritated because they were telling us at the American River that it had to be 25 feet from the end of the bicycle parkway. 25 feet from the water, I totally agree with. That needs to be done with our county American River Parkway to protect our water. My American River homeless crews have no problem with that. What we had a problem with is that more than 25 feet would cause my American River homeless crews to have nowhere to go. And they've been the ones cleaning and saving the American River and keeping it clean for the last 5 years, helping Park and Recreation keep it clean and safe down there. So we would like to know if there's any possible way, because we're told it's going to be from the bicycle pathway on, and that's the law they're trying to pass, and I hope that's not true. I hope it'll be 25 feet from the water. We have no problem with that. We agree with that 100%. The water needs to be protected, and that's what we've been trying to do all these years, keep it clean and safe for everybody. So that's what I'm here for today, to ask you guys to please keep it only 25 feet from the water law, because we know it needs to be done. And it definitely needs to be done to protect our water system. We agree with that. And also we'd like to set up a thing where we can help work with Park Recreation and Board of Supervisors, because we like working with you guys, Phil Cerna, and set up a dialogue between me and you guys where we can email each other if that's possible. Thank you.
Great, thank you, Dan. Appreciate it. And just as a reminder, again, this is off agenda, so we can't take any formal action, have lengthy discussion on it. So the next speaker is Ryan Harris.
Hello, good morning.
Good morning.
Thanks for letting me speak and hear me out. I work for Sacramento County, and I'm just here because it's kind of last resort for me. I had brought some of the items that I'm bringing before you today to some of my supervisors, bosses, managers, program managers, directors, deputy directors, and kind of didn't get anything in feedback from them. I was told that because of bringing it to their attention, I run the risk of losing my job. So I'd rather stand here before you guys and tell you guys while I have a job than come here and stand here without a job and tell you guys as well, risking a possible different reaction, who knows. Some of the things that I'm just gonna request is that management be tightened up on, and what I mean by that is that I've experienced a lot of discrimination within the county and working for them. I've worked for them for 12 years, and I've experienced a lot of discrimination while working there, even all the way up from what I believe may be the director's level with our director, Ann Edwards. I tried to notify her of some harassment that was taking place, and in return I got a call from management that said basically I need to let the issue go, and that Ann was requesting a cease on me. Later, to make things worse, she followed up with a discipline for me, and in that discipline, I was disciplined for things such as emailing my father happy birthday. Well, I later realized Ann Edwards had emailed my coworker happy birthday on her birthday, and when I asked about that situation, I received no reply. I was just given a record of discussion and told not to speak of it again. Even with the deputy director, Ethan Dye, he sent out an email speaking on my protected rights and my disability rights. And when I notified HR of it, even to this day, I've heard no reply from HR at all, not at all. And there's just countless other things. I'm trying to keep it to 3 minutes. There's just countless other things. We're told to sign off on security policies. When you look into these policies, they don't even exist. In 10-25, it says to go to 12-24. There is no more 12-24, but we have to sign off saying we understand this. In our sexual harassment policies, all the people listed as point of contacts are not even people that are correct point of contacts anymore, all of them. So, when we think back to the Me Too movement, if something did happen to someone and they wanted to go to someone and they went to our policies, they would have nowhere to go. But then we're forced to sign off on these policies saying we understand them and that they exist. And then they're held against us when things and disciplines are done. I have an email from HR that says, if you have a restraining order on someone in the building, notify your program manager. That same lady disciplined me and said, you notified your program manager, you have a restraining order.
Okay.
That's my time, I'll respect it.
Thank you. And again, just as a reminder, we appreciate you being here to speak your piece about what's important to you. We cannot take any action or have any discussion about it. However, we do have Bruce Wagstaff here, and the individuals you mentioned report directly to him. He's the executive in charge of countywide services. So I would suggest that perhaps you grab his business card and maybe you set up a time to speak with him in greater detail about what your grievances is and your concerns.
I very much appreciate that. Do you know where I could get his card at?
He's about to give it
Right
to
here.
you.
Thank you.
Thank you. Okay. Next item, please.
Item 28 is the request ratification of the proclamations of local emergency and local public health emergency for the novel coronavirus epidemic, COVID-19.
Good morning, Board Chair and rest of the board. My name is Steve Cantelmi. I'm the Chief of the Sacramento County Office of Emergency Services. And you have before you a request for ratification of our local emergency as well as our local public health emergency. The local emergency is something that I'm responsible for, so my request is for the ratification of that portion. The primary reason for the local proclamation is to ensure that we are able to manage the incident properly and have the resources available to us to do so. The proclamation essentially just opens up some avenues for us to better respond to this incident. It allows us to provide more assistance to the departments within the organization. It also gives us opportunities to get mutual aid to come into our region in the event we need those resources. And it also allows the county to take some additional measures that they would not normally take. They can write ordinances, and they can also assist with getting some of those resources made available to us. The governor has proclaimed, as you know, and through that proclamation, he has also opened up the CDAA funding, the California Disaster Assistance Act, which does provide some funding that may be available to the local jurisdictions. We're not proclaiming for that reason. We're just making note that it is available to us in the event we do need it. With that, I would request a ratification of that proclamation.
Thanks, Steve. I appreciate you being here to give us a brief summary of what the action entails. However, I would just like to add, maybe I can just simply just prompt you to see if you can articulate it better than I can. But this, by no means, in terms of the proclamation, the action of proclaiming this an emergency, it doesn't necessarily mean to the average member of the public that there's an extra elevated threat or concern. I think sometimes the public might see, declarations and proclamations of emergencies, and they equate that with some elevated threat. So can you speak to that?
You're exactly right. This is more of a preventive or a trying to get in front of the issue. Right now, we're not anticipating having any additional needs in terms of mutual aid. This doesn't elevate the incident so that it is something more than it is. We're just looking to be ready and prepared to respond. So we're not anticipating using the mutual aid at this time. We're not even anticipating making any requests for funding. It's just to allow the county to be prepared in the event we do need to take additional actions.
Very good, thank you. Supervisor Tully.
Yeah, thanks, Steve. I guess question to you, and I know Dr. Bielenson is the audience as well, but as you kind of referred to it as an incident, maybe that's just to speak in the emergency services world, but obviously this is a situation that continues to roll out on a daily basis. Obviously receives a good deal of media attention. It is cause for concern for a number of folks, a great number of folks, probably for a variety of reasons, certainly from primary health reasons, but also obviously economic and just daily life in our community. I guess my question is, though, is that in this declaration or proclamation, however you want to term it, that we talk about disaster assistance potentially being available to the state, maybe to local jurisdictions. But one of the questions that comes to my mind, because I think it will be increasingly, at least my sense of it is, something that people may be asking for, and that is the testing and who is bearing the costs of the test. I mean, there's been some inadequacies, certainly nationally, as it relates to the availability of tests, and more on the way. And again, Dr. Bielenson certainly has been coordinating with our health officials on that. But those costs, if they're being borne by a local jurisdiction, public health is not a realm where it's solely just funding from state and federal. There's a local contribution to that. So in the event that there is a ramped up, and I assume there will be, because as a couple weeks ago we weren't doing any testing, and now we'll be doing and making tests available. But who's going to bear the cost of that? And if so, if we have to bear the cost through our health department, then I would assume that that's something we could claim against to allow us to do that sufficiently, but also recognizing that it's a cost that we did not anticipate, and yet in the realm of public health, I think we need to make that available, and obviously any other things that come with that if people test positive and so forth. So I guess that's my question to you, and I know Dr. Bielenson is standing to your left, but what's your sense, at least as the emergency coordinator?
Yes, like with all incidents or disasters, the cost is a burden on the local jurisdictions initially. They're responsible for the outlay of those costs, and in the event that it reaches a certain threshold with the state, it may be eligible for reimbursement. So it's important that all of us track those costs so that we can actually submit those costs in the event we do reach certain thresholds with the state. So at the initial point of this, the county is bearing that cost. Eventually, if we reach certain thresholds, we may be able to get reimbursed for it.
And if you know, what is the cost of an individual test?
I don't know.
Okay.
Perhaps Dr. Bielenson knows.
All right, and Dr. Bielenson maybe will answer that. But then I guess my other question is, before you leave the podium, so in the event that we have to mobilize, either through personnel to assist, obviously people have private health care providers, but not everybody is enrolled in a health plan, nor may not rise to that. But so the event that there's additional testing, but also dissemination of information. And certainly Dr. Bielenson and his staff have been, lead on a lot of that. But will we deploy, public health nurses to assist, in those realms, and or other personnel? Again, we don't have a large regiment of, health officials that do that. And I guess my other question is that as it relates to institutions and facilities that the county has, people in care and custody, that, how we bear those costs. Because again, what that means to public interaction, but also where folks are in confined situations, we obviously, provide different health care as we do, but also for testing and things that we maybe didn't anticipate. Any thoughts about that, how that's being handled?
Sure. Well, one of the things that the proclamation will allow us to do is we can use volunteers, and we can also use disaster service workers. Everybody that works for local government is a disaster service worker, so we're able to cover them under the Disaster Services Act. It gives them some protection in terms of health care in the event they're injured or in the carrying out of their duties as a volunteer or a disaster service worker. So that assists us. So that's one of the reasons why we would make this proclamation. There's other avenues in which this opens up for us to use in terms of volunteers. But at the end of the day, the local jurisdictions are responsible to provide that assistance. So if we exceed our ability to provide the deeded staffing or that we would need here locally, then we would actually go out to a mutual aid and make those requests.
Okay, one other question for you, and that is that as public service provider, a large organization, we have dozens and dozens of public buildings, public facilities, and so forth, and obviously we employ in large part our own staff to do cleaning and to do other necessary items. I saw that somebody just brought up to the dais here some hand sanitizer, Purell. So are there costs if we does the county bear the cost if in fact we have a different regime for say doing door handles for extraordinary cleaning of restroom facilities, of where we have public gatherings, this facility for example, surfaces and so forth? Is that something that we try to track at least on a nominal basis so that we have some understanding of those costs in the event that we begin to reach some of those thresholds that you referenced? And if so, who's responsible for gathering that information, but also assuring that that's done?
Yeah, there's absolutely a potential to be reimbursed for those costs, and the need to track those costs are really borne by those departments that are responsible for doing that. So the county does have a system. Finance is assisting with tracking this information. So each department, though, is really responsible for tracking their own costs that are related to the event. And then at the end of the day, when the event is over, that's when you submit for your reimbursement, if you reach the threshold.
One final question for you then is, so we also contract with a number of parties for a variety of services, including, I think, food service, food prep, for delivery of other goods and products. Do we have anything that should this go to that proportion that allows us to assure that those that are in our employ, whether they be county employees, but also those that we contract with to provide other services to the public and or to county facilities, that they follow certain protocols and certain regimes? Obviously things are being recommended relative to hand washing, good cleanliness and sanitary practices. But in the event that we get into another situation that this grows beyond what might even be expectation relative to disease spread, do we have the ability then through through OES and or through the health officer to make sure that we can have confidence with those not only that we employ but those that we contract with will provide, follow certain protocols?
Yes, the best practices are to capture all your costs, track them, and submit them, even if you don't know whether there is an item that can be reimbursed for. That's a decision that will be made later by either the state or the federal government if they were to declare. So we've actually delivered classes, training for the departments and the stakeholders outside of our county to learn how to track those, what's important to track, and how you do that. We have actually a class coming up here in about a week to help reinforce those practices that are used nationwide in terms of how to track costs and what are the best practices. So I'm confident that we as a county can do that fairly well. I can't speak for the cities or the other jurisdictions out there, but they have had opportunities to be trained.
Okay, but I'm not just so much tracking costs, but I'm talking about the oversight that assures that, whatever may have not been anticipated in the contractual relationship, do you coordinate through that, or does that come through Dr. Bielenson and public health as it relates to direction to those that we do business with?
If it's something that is contracted or directly related to a public health department's request, then they would be responsible for tracking that. Each individual department is responsible for tracking any resources or any costs that they might have, and then that is all gathered and provided to us, and we assist getting that information to the appropriate state agencies for that determination as to whether or not they would be eligible for reimbursement.
Okay, thanks.
Supervisor Peters?
Thank you. I had a question for Dr. Bielenson. Thank you, Chief. Thank you. The new press release that went out yesterday talking about the shifting the effort to mitigation. I've read it, and I've read it to several people who ask me, and I think people don't really understand why. And so I guess you aren't using the word quarantine anymore, but you're still asking people to go home if they feel they have the virus.
Sick.
So maybe
Correct.
a little more detail on that.
So yes, so we're moving from containment, which is contact tracing and quarantining people, to mitigation, which is trying to reduce the risk to those who are at most risk from this disease, which tend to be seniors and those with chronic underlying conditions. The key is to try and keep those folks from encountering people who have the disease so that they don't get it. That's the big effort.
So why shift out of the 14 days? I'm trying to...
So we're not going to be quarantining. So the answer is we're not going to be quarantining going forward, with few exceptions. There are a few exceptions, potentially people who are, and we, by the way, we've been working with the UC system, the 5 schools in Northern California, to go over, so we're having similar guidelines. So if there's a healthcare worker who's directly taking care of a sick patient who coughs on them, we might quarantine them until we test them. But in general, people are going to not be quarantined. They'll be...
So you're getting rid of the blanket quarantine,
correct,
more or less, and going more to
correct.
specific
And the rationale
individuals.
for that is that there has been community spread. Now, you may say there are only 11 cases, because we have 11 cases so far with 1 recovered. But the answer to that is, to Supervisor Natoli's point, that we've had very little testing available until, actually, as of still today, we only can test 20 people a day. So we've been testing 20 people a day for a few weeks, and so that's like 160 people, or a couple weeks, so that's like 160, 180 people that we've tested. So if 10 of them are positive, that's, a sizable number. And
So because you're adding additional labs, you have the ability to
we
test
will
more.
be adding additional labs when LabCorp and Quest come online. Right now, they're really not online, despite that they've been said that they would be, and that when they come online, we actually have to send the swabs to North Carolina. So it's going to delay some period of time. So even when we get LabCorp and Quest later this week, there will still be a delay in the response time. To Supervisor Natoli's other question, one of several questions.
Right.
Those tests will be done through their doctor's offices. The 20 tests a day that we do will be for high-risk people, seniors, et cetera, that have significant symptoms, or hospital workers. The others will go through their doctors. Once this kind of gets up and going, LabCorp and Quest, which is what you use for any lab test that you have, right? It'll be prescribed by a doctor, if you will, and the test will be done and sent off, and then the healthcare costs, those costs will be borne by either the patient or, depending on what the governor has done, the state.
And did you say when you thought those labs would be coming on board?
We keep hearing every day what's happening.
Momentarily.
Yeah.
If I could, I'd like to, if Supervisor Peters has concluded her questions, I'd like to put a finer point on it. I think we're all in receipt of various emails from constituents that landed in our inboxes late yesterday following the message that we're moving into a mitigation phase. And I don't think any of us welcomes the fact that we're thrust into a context now where it's a very technical, medical, clinical environment in which we're trying to explain things, but none of us is a medical doctor. You are, and we have a very capable staff that really understand the science behind this and how best to contain and to deal with the virus. I would like for you to work with our CEO to see if there's any opportunity maybe to carefully word an explanation that our offices might be able to use in response to some of those concerns that are expressed by our constituents that explains the mitigation part, because I'm not sure that without that we can put to rest some of those fears. And then believe me, the words that are being used by some of the emails that I'm receiving, the people that are emailing us, they're very, very concerned about this move without understanding it.
Yep.
So we are in process working with Dr. Bielenson and his staff on FAQs, and we'll have that on the website about the mitigation, so that'll come out shortly.
Okay, great.
And also Dr. Bielenson has press availability starting at 10:30 today. Same time questions we're getting to get that message to the media too.
If I could,
yeah.
Sorry, go ahead.
No, go ahead.
If I could, without sounding like I'm trying to
Could you speak up a little bit, Dr.
Sure.
Bielenson?
Without trying to underestimate what the issue is, or undercounting what the issue is. In 25 years of being a public health official, I've dealt with this.
Hey, Flo.
Can you raise?
I've dealt with these things every 4 or 5 years, and I'm sure that Supervisor Peters and Supervisor Natoli have as well. Thank you. There's H1N1, there's West Nile, there's SARS, there's MERS. Every 4 or 5 years, a new virus, and it's always a virus. Why? Because there's no antibiotic for it, because antibiotics only treat bacteria, and there's no immunization available because it's a new virus. These viruses come out with a bang because people die of it early on, because only the sickest tend to go into the hospital or into their doctors and end up and the mortality rate is high to start with. And what always happens, which is already happening with this virus as well, is that the mortality rate, the number of deaths over the number of cases starts out high, but as more and more people are tested, and they're tested and they come back positive, but they're mild or no symptoms, which in the international data to date, 81% of all cases are either mild or no symptoms, that the death rate goes down dramatically. And within a few months, an antiviral medication is developed, and within a year, an immunization is developed, and this becomes part of the constellation of infectious diseases that go around the world in a seasonal manner every year. Perfect example is H1N1, which is now one of the flus, and we have an immunization against it. So without understating the problem, the mitigation, and to Supervisor Cerna's point, is predominantly to try and protect those who are most at risk. With all the data shows that those most at risk are senior citizens and those with chronic underlying conditions. And so we're trying to protect them through our efforts as much as possible. On the other side of the coin, there's usually a U-shaped curve of how people are affected by a flu-like illness, where the very youngest and the very oldest. In this case, the youngest are not seeming to be affected at all, virtually at all. The rate of infection is the same. In other words, they're getting infected at the same rate, but they're symptomatically not showing symptoms. And so that's one of the reasons that we're recommending for school kids, as well as for any adults who are younger than senior citizen age, that they follow basically the protocols you would follow for the flu. If you're sick, stay home. If you're really sick, call your doctor in advance so that if you have to see the doctor, they have prepared a side entry just so like you don't go into a doctor's office with the flu. And if you're really, really sick, you go to the hospital. And we're trying to do that to protect our hospitals and our emergency rooms from being overloaded when we already have other issues that they should be used for.
I wasn't quite finished. Yeah, thank you. So I'm glad to hear you have a press availability at 10:30. I think that will probably help a lot. And would encourage you to come up with a really easy to understand response on this mitigation versus containment. Because it's hard for people to understand.
Does the senior citizen thing not work?
Pardon?
Does the senior citizen thing not work? I'm asking you.
Yes, for me, but I've been hearing about this for 2 weeks, so I'm not sure that people who haven't.
No, we'll make sure that it's easy to understand.
Yeah.
Absolutely.
You're very good at not sounding too much like a scientist, but you are a scientist, so you need to get a layperson to understand what your comments are. And then one other question was, people who test positive but are asymptomatic, does that give them immunity the next time it comes through?
Very good question. I actually went online this morning because I've been saying that, and I've been trying to confirm that, and it appears to be true at least for a period of time. You would think that it would be, but because the viruses mutate very frequently, it may not be 100% true, but it is true initially. So if someone tests positive, they're not going to get it in the next few weeks or next few months.
Okay, thank you.
Supervisor Frost.
I'd just like to add a little bit to the containment versus mitigation, containment to mitigation conversation, and just say, I'm getting calls and emails about this too, and people are concerned that we are moving out of quarantine, and I'm wondering if we can message it in a way that says that we're at that point where if you begin to feel symptomatic, you self-quarantine. That's part of the mitigation protocol.
Yes.
So we're not really they have the impression that we are disregarding the quarantine and that we are basically setting everyone up for a catastrophic problem. So
that's a good point.
So maybe it's just a way of saying, instead of we're moving out of quarantine, we're just we have so many people. It's getting to that point where we need people to self-quarantine and teach them the symptoms so they know what to do at what point. And then I wanted to also mention that I have some communications regarding people, some of our population feeling discrimination around, people are no longer going to the Chinese restaurants. I know that there will be an economic impact, but is there a way that we can include in our communications that this is going to be difficult for a period? It won't last forever. There are many businesses that may be impacted. You're not singled out. No one's being singled out. In fact, it's not just our Chinese community. A lot of people may not go anywhere for a while. They may stay home. Just include that in our messaging so that we can put their, people are nervous and we want to put them at ease. And then the other thing I wanted to ask you about is the local labs versus North Carolina. Are we going to bring it locally as this begins to expand? When are they coming here with
so
that test?
Very good question. I meant to do that. So first of all, the lab tests that we have available now at Sacramento County, in Sacramento County, we're one of only 14 counties, 14 or 16 that has them. They're at our Sacramento County Health Center, our FQH, our Federally Qualified Health Center. We do 20 a day. Those are our own, and we do our own testing. But that's only 20 per day. The LabCorp and Quest, which will be doing much more, many more tests, will eventually be able to locate here. But for right now, we're having to send them to North Carolina. Well, when we get them, we'll be sending them to North Carolina.
And so, okay, 20 a day isn't, so,
No,
I mean,
it's not.
we need to be able to do all that we need to do. So when is that, so,
We're told any day. This is coming from the CDC.
sorry,
and
I
the
was,
federal.
my mind was wandering.
No.
And can you give us some messaging on at what point do you stay home? What are the symptoms, and at what point, so that we can help people understand at what point is it prudent to self-quarantine?
The primary symptoms are fever, cough, and shortness of breath, which obviously is similar to flu and other illnesses, which is why we're encouraging people to do what they would do with the flu. It's actually, even for seniors, this is like a significant flu season. If you have, whether you're young or old, if you have symptoms, stay home, avoid contact with others, and as much as you possibly can. If you're really sick, call your doctor. If you're really, really sick, go to the emergency room or a hospital.
Thank you, doctor.
It's somewhat like if you have the flu, the regular flu.
Yes,
you stay home if you don't feel well.
Exactly.
Call the doctor
exactly
if you
what
feel
we're-
worse.
It's the same virus. It's a similar virus. It's the same respiratory droplets, and it has the same symptoms, and it affects most seriously the seniors and those underlying conditions. And just so you know, to put in perspective for your constituents, this year there have been 29 million cases of the flu, 240,000 hospitalizations, and 19,000 deaths in the United States alone this year. So that keeps it in perspective, because we've had this in our community for quite some time now, and they're not huge numbers of people dying.
Supervisor Natoli?
Yeah, thanks, Dr. Beavis. I just wanted to follow on a couple of questions. One, back to the testing. So we're able to do 20 a day. How do we prioritize who gets tested? And the second part of the question is that when things are able to ramp up any day now, what's going to be the capacity at that point in time? Is it going to be 100? Is it going to be 1,000? What is our capacity?
We think more like 1,000, but again, we've been told by the CDC things, and we haven't seen them in actuality. In terms of the 20 that we're doing, we triage the people. We do it with healthcare workers that are actively on the front line and seniors who have significant illness. Those are the two that we do now. We don't test the average person. Like if any of you, had if you did, we probably would test you. If I had the illness, I would not get tested. Whereas once we go to what's called Tier 3, it'll be available to anybody who wants it.
And when you say anybody who wants it, so they have to go through their healthcare provider, or they could come to the health department?
No, they have to go to their health provider first.
Okay, but if they don't have a health provider, I mean, most folks do now because of the coverage. But
most, they can go to the FQHC.
Okay. And we say any day now, and that information is coming down from the CDC. But what if the demand was there? You triage the 20, but if the spread, that's it, we're limited to 20. So even if we had 40.
With mutual aid, the other counties are already full as well. So
okay,
there's nothing to do.
So the question, until they get ramped up here in California, whenever that is, what's the turnaround time to? I assume you do overnight or overday to North Carolina, and you get it back. Did they report it back to you? How is that? What's the turnaround?
So in our own tests, we can turn them around in several hours. The 20 that we do ourselves, and the LabCorp and Quest, which I don't believe are even online yet, if they are online, but it'll be about a 4-day turnaround, right? Because it's a day there, a day back, and then 24 to 48 hours.
So
but to be honest, in many ways, it doesn't really matter anymore if we test, right? Because we're going to self-quarantine if people test positive. If people have signs or symptoms, they would self-quarantine. You don't need to quarantine for 14 days anymore, though, by the way. And if you test positive and you're asymptomatic, you go about your business. If you have, if you test positive and you have some symptoms, you stay home. If you test positive and have significant symptoms, then you go to the doctor. So it's really doesn't matter terribly much if we test or not anymore.
So without diving too deep, doctor, oftentimes, though, folks, before they know they're sick, they already are. So is the contagion immediately there if someone who's contracted it but may not even know that they got the symptoms until they start feeling a bit peaked or whatever? So
incubation period is 2 to 14 days. You can be shedding virus without having symptoms. In other words, you can be contagious without having symptoms. You're most contagious when you have symptoms. But that because you can shed virus without knowing you have symptoms or without knowing you have the disease, and that's the whole reason for containment versus mitigation right now. It's been spread around, and I would venture to guess, if I had to, that at least one person in this room has had it.
So with that being said, I appreciate sort of the calmness of the approach, and I think the very thoughtful, I think references you make on, perspective on this, but nonetheless, obviously this receives round-the-clock coverage in the media, and I think with some of the events in the community over the last few days, I think risk and exposure and all those things, and you look what happened internationally, and in Italy and other places. So my two more questions. So one is that are we doing anything different as relates to guidance for public facilities? Again, Supervisor Frost and others have, referenced, the interactions, people going out to eat, going out to public events, and we see Santa Clara, declares yesterday, their county, that, anything gatherings over 1,000 prohibited. So, those types of things send messages to others, and so what's the guidance that you're receiving, but also that you're giving both for county facilities, but also other public facilities?
Yeah, so on a variety of issues. First of all, the 1,000 doesn't really make sense, right? Because if there's 850 people, that's okay, but if there's 1,050, that's not okay. So that doesn't really make sense. The biggest thing, again, in terms of mitigation, trying to reduce the risk to seniors, is actually if you're going to have a senior a conference of seniors or an AARP conference or something like that, and there are 50 people coming, I would recommend probably not doing that. If there are 1,000 people going to Golden One for a high school basketball game, that may be a different story.
Can I interrupt? Yeah. We know that you need to get with the press. You're T-minus 8 minutes here. However, on that point, I just want to get this in. What are we doing to communicate with the most vulnerable population, which you've stated many times, which is our elderly population, in coordination with the Area 4 Agency on Aging?
So we give, as far as I understand, we've sent out all our information.
Can you speak up, please?
We send out all of our information to the Office on Aging.
That's correct, but Supervisor, we can circle back with them today to see if they need anything more.
Well, that seems the logical conduit to.
Yes.
Absolutely, and there's others too. I think there are
We've been
others
meeting
too.
with nursing homes and all sorts of things.
So all our information is going out to them. I think we are going to renew the efforts, make sure you got this information. What else do you need? What can we do? Right. So that we'll take that advice.
For example, nursing homes now, I visited several of them. They all have this guidance up on their front door.
Gotcha.
And I would just say in-home supportive services. We have caregivers who a lot of times are offering personal care. They're, some of them may have, limited English speaking abilities, and I do think it's important beyond, just what would be typically in the English language, is make sure that working through IHS Public Authority to the folks who are caregivers, that we get that information out, because again, those are largely individuals or small groups that are being tended to by those caregivers, but different than skilled nursing facilities or other acute care facilities or board and care homes. But I think that that communication, where again you have vulnerable populations, whether it be elderly or maybe already compromised health-wise, and where exposure could be very risky for them. One last question then, and certainly a thank you for your work with the the Elk Grove School District. I know that as recently as last evening that I met with folks and with the County Office of Education, coordinated a meeting with the superintendents throughout the county. I would also ask that, in addition, I know you've briefed the City of Elk Grove folks as recently as yesterday. I think it's important that to our other city leadership and all the incorporated cities in the county, obviously City of Sacramento and City of Elk Grove have been tuned in, but I think we need to make sure that maybe now through you, calls to city managers and offer information beyond what obviously is being made available, but if they need to have a briefing for their leadership in their city, because again, they employ folks that are in contact with the public, they have sanitation workers, they have folks going to people's homes, they have folks in the public works realms and so forth. So I think if we could make sure that our partners in leadership.
Which they are, we have a whole process through Steve's operation where there's been communication, the PIO's been in conversation, everything that we've been putting out, they've been picking that up and sending it out to their employees. So we'll keep that effort going, but I just want to assure you that that process has been in place for a couple of weeks now.
Okay, but you've offered briefings to the cities if
no, I've not offered briefings, but through Steve's folks, we have given them the information, and I think it goes without saying, but we'll double check with them. If they want a briefing, we'll brief them, but they have the information, and a lot of close contact with our PIOs, their PIOs, what information, so that avenue is there.
Okay.
I'm watching the clock too.
One final question, or comment about private schools. Public schools have, a certain realm in administrative structure. Any number of private schools, so make sure we get information out to those institutions as well. Your Montessori's, and your daycares and others. Even though it sounds like some of the younger population may not have the same risk factors, although we've identified some with positive tests here in the county. So
I've dealt directly with several of them, and we've also put out our information. But I've actually talked specifically to several of them.
Okay, thank you.
Supervisor Frost.
Dr. Bielenson, can you please speak to our homeless community members and the impact on them and how we're going to deal with that? And does it impact our communities as far as contagions?
Very good question. So as of right now, there are no known positives. Granted, we've only tested about 160 people, so you probably wouldn't have picked them up. We looked at doing questionnaires to put on the street or on the parkway in terms of symptomatic of people having symptoms, but so many of them have these symptoms that I've already described that it'd probably be overkill. So we're doing several things. First of all, the outreach workers and navigators from Sacramento Covered, from DHA, from Sacramento Steps Forward, et cetera, are all going out and doing kind of mini exams on people. Secondly, we've gotten hand sanitizer in terms of 2,500 or 3,000 of them, which were hugely price gouged, by the way. We were able to negotiate down to only $1 an ounce, but they're going for $8 an ounce, which is outrageous. And our hand sanitizer is coming this week, which was good. And that is useful. 60% alcohol is useful in terms of, because obviously the hygiene and washing your hands is not available to a lot of homeless folks. Secondly, if there's anyone that's sick that needs to, in this case, would sort of quarantine, because otherwise they can't stay home. Right? We have motel rooms throughout the county, throughout all the districts, that we use like for TB and other types of things regularly. So we have those available, and because of this announced declaration, we're able to get more if we need them. And then thirdly, if they're ill but not really sick, they stay there for a few days, and then they be released. If they're sick and they have symptoms, again, they go to the doctor, and if they're really sick, they go to the hospital emergency room.
So at this point, instead of having the press conference here at the podium, I would like to let Dr. Bielenson go have his discussion with the media, who is obviously showing up here precipitously. So if there's no further questions, I think that's probably the best thing to do at this point. Okay? Thank you.
Good.
Appreciate it.
Thanks, Dr.
Thank you.
Supervisor Cerna, you need to have someone make a motion.
Right. Thank you.
Second.
Okay, it's been moved by Supervisor Frost and by Supervisor Floyd. Please vote.
Unanimous vote.
Thank you.
Okay, item 20. Item 29 is the public hearing on the benefit category change and levy of increased service charges for the Gibson Crossing subdivision within Zone 1 of County Service Area Number 1.
How do I lower this?
Like a foot shorter than. Thank you.
Too short.
Good morning, members of the board. My name is Dorothy Kodani, and I'm a senior civil engineer with the County Engineering Division. And this is actually the first of 3 items that I will be presenting to your board this morning. This first one concerns the Gibson Crossing subdivision, which is on the north side of Alberta Road, approximately 1,000 feet west of Watt Avenue. The tentative map for the subdivision proposes 162 residential lots and a park parcel. And in response to entitlement conditions of approval, a request was submitted to initiate the benefit category change for County Service Area Number 1, which provides street and safety light services in the unincorporated portion of the county. Therefore, a notice and ballot were mailed to the property owner on January 24th. And this development is comprised of 2 parcels currently. Parcel 20300500056 is currently in the safety light only category with an annual service charge of $2.56, and parcel number, which ends in 036, is classified as an irregular or miscellaneous parcel, and it is too small to be currently assessed. The proposed benefit category change would change the category to the enhanced street and safety light residential category with an annual service charge of $49.64 for the 162 proposed residential lots, and for the 2 non-residential lots, it would be proposed to be $327.04 for an annual charge based on current fees, or current rates, excuse me. So if there are no questions of the remaining members of the board, we recommend that the public hearing be opened, considering all written and oral testimony and objections and protests, close the public hearing, and direct the clerk to tabulate the return protest ballot.
Okay, and at this time, I do not see any questions from the board, and I have no questions, so at this time, I'll open the public hearing. And I do not have any comments from members of the audience, and so close the public hearing, and we'll tally the voting.
So we have 1 ballot. The legal owner is Gen California 12 LLC for the parcel numbers that Ms. Kadani had read into the record. The site address is Alberta Road, Antelope, California, and we do have a vote in favor.
So,
yes, thank you, Flo. Thank you, Supervisor Frost. So since there is no majority protest, we request that the board adopt the attached resolution to approve the benefit category change. And as far as the fill-ins in the resolution, I can read those into the record. Section 2 of the resolution, at the close of the hearing, the board had received 0 written protests, which the board finds and determines do not constitute a majority protest. Section 3, at the close of the tabulation, the board had received 1 protest ballot, totaling 100% of the total service charges to be levied, of which 100% was in favor of the benefit category change and 0% was in opposition to the change.
okay, so since this is my district, I'll move approval, and seconded by Director Peters, or Supervisor Peters, and please vote.
Unanimous vote with those members present.
Thank you.
Thank you very much.
Okay, and then we have another one for item 30. This is County Service Area Number 10, Benefit Zone Number 3, the public hearing on establishing a service charge within the Hedge 22 subdivision.
Good morning again. Dorothy Kodani with the County Engineering Division. And the Hedge 22 subdivision is located approximately 2,000 feet north of Gerber Road and west of Waterman Road, and it proposes 22 residential lots. And in response to a rezone condition of approval, a request was submitted to initiate the establishment of a service charge for County Service Area Number 10, which provides trip reduction services. So in response to that, a notice and protest ballot were mailed to the property owner on January 24th. And this item proposes the levy of an annual service charge of $112.68 per single-family residential lot. So again, if there are no questions from your board, we recommend that the board open the public hearing, consider written and oral testimony and objections and protests, and close the public hearing, and then direct the clerk to tabulate the return protest ballot.
Seeing no questions, I'll open the public hearing, and I have no requests for comment or hands raised in the audience, so I'll close the public hearing, and we will count our ballots.
Okay, and again, we have one ballot. And the legal owner is Hedge 22 LLC for the site address at Hedge Avenue for the parcel number that Ms. Kadani read into the record, and they are voting in favor of the increase.
Thank you. Since there is no majority protest, we request that the board adopt the attached resolution to establish a service charge on the Hedge 22 subdivision. And again, we can read into the record the fill-ins in the resolution. Section 2, at the close of the tabulation, the board received 0 oral and written protests, which the board has duly considered. Section 3, at the close of the tabulation, the board received 1 protest ballot totaling 100% of the total amount to be levied, of which 100% was in favor of the service charge and 0% was in opposition to the service charge.
I move staff recommendation.
Motion by Supervisor Natoli, seconded by Supervisor Kennedy. Please vote.
Unanimous vote with those members present.
Thank you again.
Okay.
Item 31.
And this will be a, well, I'd like to make a note. There's a correction to the supervisorial district. This is residing in Supervisor Natoli's district. The record had Kennedy and Cerna, but this is only for Natoli in his district. This is the public hearing on the formation of Benefit Zone Number 4 of County Service Area Number 10 from Benefit Zone Number 4. Approve engineer's report, state the intention to levy service charges, and direct the clerk to mail notices and protest ballots.
Thank you again, Flo. Good morning again, Dorothy Kodani with the County Engineering Division. County Service Area Number 10 was formed in May 2003 to establish a financing mechanism for trip reduction activities. And these activities can include shuttles, van pools, and promotion of travel alternatives to area residents, employers, and schools. Benefit Zone Number 3 is currently the only active zone within the unincorporated portion of Sacramento County and encompasses the North Vineyard Station, Florin Vineyard, and Wild Hawk North planning areas. The Easton development is located on 8,500 acres owned by the Aerojet Corporation and is conditioned to annex to County Service Area Number 10. Due to its location, it's actually proposed to form a new benefit zone, which would be called Benefit Zone Number 4, to accomplish this annexation. And the proposed budget for Zone 4 includes a community shuttle and a transit subsidy for residents and those wishing to utilize the services within proposed within the zone. The proposed annual charges, as detailed in the documents that have been prepared for you, include $165.62 for single-family residential dwelling units, $94.41 for multifamily, per 1,000 square feet for retail and commercial service areas, $233.53, and for office area per 1,000 square feet, $193.78. Again, if there are no questions from your board, we recommend that the public hearing be open. Again, testimonies, objections, and protests be considered, and that the public hearing be closed at that time.
Seeing no questions, this public hearing is open, and seeing no comments or cards, the public hearing is closed. And if you would please
There's actually no ballot for this one, and so...
No, okay, so...
So I would just request that, since there are no protests, that we adopt the attached resolution to form benefit zone number 10, benefit zone number 4 for County Service Area 10 without an election, to approve the engineer's report, state the intention to levy service charges, and direct the clerk to mail notices and protest ballots.
Move staff recommendation.
So moved by Supervisor Natoli, second by Supervisor Kennedy. Please vote.
Thank you for the easy morning.
Unanimous
Thank you.
vote with those members
Thank you,
present.
Dorothy. Well executed. And next item, please, moving on, as Board of Supervisors and Sacramento County Public Utilities Financing Corporation.
Is the approval for the issuance of the County of Sacramento 2020 refunding certificates of participation, all corresponding documents and actions.
Good morning, members of the board. I'm Colin Bettis, the County Debt Officer. The item before you this morning is a standard bond refunding in which you are asked to act as the County Board of Supervisors and the Board of Public Facilities Financing Corporation. Materials relating to the estimated savings and the form of the documents associated with this transaction are included in the board letter and attachments. The financing team and I are available for any questions you might have. Thank you.
Supervisor Natoli.
Yeah, again, I think it was outlined in the staff report, but Colin, if you might just take a moment and explain, I think, again, for those that may be tuning into this meeting and not here in the chambers, what this will result in. Obviously, it's going to be in refinancing some of the certificates of participation, but it also, we're going to capture some of the lower interest rates, but what the savings are, what the offset is to the general fund versus what would happen if we didn't take this action, at least as contemplated. So if you could just take just a brief moment to do that, I think it'd be
absolutely.
helpful.
So current estimates are that the additional need from the general support to pay the debt service on the current bonds would grow from approximately $3 million next year to about $5 million towards the end of the debt service period. The estimated savings on this refinancing is about $2.2 million per year, which will reduce that need for the general fund to support additional debt service.
And there's 9 years remaining?
That's correct.
So for what this ends up doing is that given the financial issues that we're having, if this financing goes through, given the volatility the market's having, that does alleviate some of the pressures that we were going to have to put more net county cost into it. So for us, this is very positive if the market stays where we need it for it to stay.
Yes.
And just one follow-on, Nav, and it was in the report, but related to coming from 1999 forward relative to the fixed asset acquisition fund, which is, a pooled account to help departments with certain acquisitions and the financing that stands behind that. So what would, if I understand that when we allowed departments to tap that fund through the budgetary process, that they didn't take into account the interest going forward, and so that's what's resulted in this general fund increase in contribution, or what?
So if I could respond to that, portions of it were in that there was an allowance for those departments to pay back those loans early without paying the additional interest. The bonds that we had issued had a call date 10 years out, and so if the departments had paid down that loan earlier, then they wouldn't have been paying on that ongoing interest. And so then that would have caused the general fund to have a greater portion of the responsibility.
And that wasn't known to us from a budgetary.
So if the department would have, if we had the ability to call all the bonds when the department had prepaid that loan, then we would have called the bonds and not had that ongoing debt service. Yeah.
Okay.
So it was a timing mismatch that we got into. So we've been trying to fix that ever since we found that issue was out there.
So in the event that we were to bond in the future for that particular aspect of support for departments and acquiring equipment and asset development, then we would look at call dates for payoff. Are we going to build in interest or what?
Yeah, we would look at it. I think not being here, but I think I can sort of speculate what the decision got made, if the term of the loan was more generous in payback, it was easier for departments to pay back. So we would have to, if we get to that spot that we issue debt for that, we would look at both the call date, we'll look at the final maturity date, and have that discussion almost on an annual basis with Collins Group to see how the payments are coming and do we need to recalibrate. Part of this, when we hit 2009, 2010, at that point, a lot of these payments and things we had to be redone because the departments, either you pay back this or you're cutting services. So we got into that conversation. So we learned a lot from those years on how some of these things were structured, but we'll have to look at both dates as we go forward.
Well, if I recall correctly, we were covering the sheriff's portion of this several years in the general fund through the other departments, if is that correct?
We did the sheriff, we did animal care, and there might have been one more, but I think those are the two that stick in my mind.
Right.
And then we finally flipped it back to the general fund.
Right, because it was like $5 million a year, if I recall.
Yeah, pretty close. I think sheriff was like 4, animal care was 1.8, so 5.8 million.
Right, yeah, okay. All right, thanks, Mr.
Thank you. No other questions, and I want to thank you for working on saving us money. That was a great move. Motion by Supervisor Peters, second by Supervisor Kennedy. Please vote.
Unanimous vote. Unanimous vote with those members present.
Okay, and moving forward as Board of Supervisors and Housing Authority of the County of Sacramento. Next item, please.
Item 33 is the Pacific Rim Apartments, approval of final tax exempt bonds and loan documents.
Second.
Moved by Supervisor Kennedy, second by Supervisor Peters. You got off easy today. Please vote, unless someone has questions.
Oh, I have something to read into the record regarding the Housing Authority resolution.
Sorry, we got ahead of you.
In Section 9, the bonds will be registered rather than authenticated in the second sentence. And in Section 10, we are adding authority to terminate the existing bond regulatory agreement. Given a new bond regulatory agreement, will extend the term of affordability for 55 years.
Okay.
Still second.
Okay, well, we have a motion and a second, and comments by Supervisor Natoli.
Just a question, so the difference between registered and authenticated, please offer that distinction. What's
Yeah, we have bond counsel here, Paul Tolan from ORIC, and he can help answer that important question.
Okay.
Thank you.
Good morning, Paul Tolan from ORIC. The difference between registered and authenticated is associated with the structure that we're using. In a pledge and assignment structure, the bank operates as both the lender and also as the agent for the issue of the bonds. So there's no separate fiscal agent or trustee, and so the bank would take the bonds and then register their ownership as opposed to a trustee who would authenticate the bonds on behalf of the bondholders. So it's merely a technical change and a typo on my part, for which I corrected.
Okay, good. Thanks, Paul. Okay.
Thank you.
Thank you.
Thank you very much. Well, so,
hours for explaining
so we have a motion and a second, so please vote, please.
Unanimous vote with those members present.
Thank you.
Okay, and that concludes our morning, and so at this time we adjourn to closed session and we'll return at 2 p.m. Oh, we can do appointments. Yes, thank you. Good idea. Let's move forward to appointments.
That would be item 37. Okay, so you are continuing to April 21st, the Assessment Appeals Board, County Service Area 4B, Slough House, Wilton, Cosumnes, County Service Area 4C, Delta, and the Southeast Area Community Planning Advisory Council. For your items today, you have the, is someone going to be doing the chairman's?
You have the notes for Cerna?
I do not.
I
sorry.
do.
You do? Okay, and I have some notes as well.
Okay.
Okay.
Do you want to just go ahead and do it?
Yeah.
Okay. Or did you
Are you on adult and aging?
Yes.
Yeah, the chiefs recommend April Carney and nominate Preston Romero to the general public seats and continue the remainder April 7th.
Okay. And then we have the Children's Coalition,
Continue to April 21.
Cordova Community Planning Advisory Council,
And March 24th.
Equal Employment Opportunity,
Continue to April 21st.
Fair Oaks Community Planning Advisory Council,
I'd like to nominate Ron Lee and request the process be waived.
Please vote.
unanimous vote with those members present.
The remainder to April 21st.
Mission Oaks Recreation and Park District.
Nominate Patty Todd for the District 3 appointment.
Okay. Natomas Community Planning Advisory Council.
That I don't have.
Okay, I have notes to appoint John Casillas, Mariana Sabanayo, and Sheila Ellis, and forgive me for butchering the names.
Say that again. 3 times.
Okay, then we have the Recreation and Park Commission.
For me, continue to March 4th.
Okay.
March 24th.
Sacramento County Bicycle Advisory Committee.
Continue to April 7th.
Sacramento County Mental Health Board, Supervisor Natoli.
Yes, nominate Teresa Rivera for the family member seat.
Okay. And then Mr. Kennedy for SAC Housing and Redevelopment Commission. And finally is the Sheriff's Outreach Community Advisory Board, Supervisor Peters.
Nominate Robert Olmsted and request the process be waived.
Okay, please vote.
Unanimous vote with those members present.
Thank you very much. And there being no business remaining, we are adjourned to closed session and we'll return at 2 p.m. Thank you.
Okay, I'd like to call back to order this meeting of the Sacramento County Board of Supervisors for Tuesday, March 10th, 2020. Madam Clerk, will you please call the roll and establish a quorum?
Yes, Supervisors Frost.
Here.
Kennedy.
Here.
Natoli.
Here.
Peters.
Here.
Cerna.
Here.
And you have a quorum.
Great, thank you.
So your first item would, is the 2 o'clock planning item, the Wildflower Solar Project. It's a zoning ordinance amendment, minor use permit, special development permit, and design review to allow a 15 megawatt commercial solar generation facility on approximately 91 acres. Located west of the U Street and west of 6th Street intersection in the Rio Linda Alberta community. The environmental document is an addendum to a prior mitigated negative declaration.
Madam Clerk, before we hear from staff, do we know why it's so dark in here?
No, we can play with the lights.
Okay.
Good afternoon, Chair Cerna, members of the board, Chris Bahuli, and I will be giving the staff presentation this afternoon. The Wildflower Project site is comprised of 4 parcels and is bounded by West 6th Street and the western terminus of West U Street to the east, and the Western Pacific Railroad tracks and the Natomas East Main Drainage Pond to the west. The project site is approximately 91 acres and is zoned heavy industrial with areas of flood combining overlay. Parcels surrounding the project site primarily are vacant or contain existing public utility, industrial, and residential uses. Considerations to develop the project site for energy generating purposes date back to 1994. In May 94, the board approved entitlements for a cogeneration power plant and ethanol manufacturing facility. Although the project was never constructed, the zoning agreement remained in effect on the project site. In 2009, a request to develop the project site with a utility-scale renewable solar facility was received. Because the zoning agreement limited the use of the project site to that of a power plant, the zoning agreement required amending. In May 2010, the board released the project site from conditions imposed by the prior zoning agreement, and a new zoning ordinance was adopted with a special development permit to allow a solar facility on the project site. The North Sacramento Solar Project was never constructed and the special development permit expired. However, the zoning ordinance remains in effect on the project site. The project site was purchased by the applicant in November 2018. The applicant intends to develop the site with a photovoltaic solar energy facility consistent with the use permitted with the prior zoning ordinance. However, planning determined that the substantial compliance could not be made with respect to the prior project, primarily due to the modified footprint of the proposed facility. As such, the current project proposal requires the following entitlement requests: a zoning ordinance amendment to release the property from the prior ordinance conditions, and adopt a new ordinance to allow the solar energy facility, a minor use permit to allow a 15 megawatt commercial solar facility, a special development permit to allow deviations from street tree requirements on West 6th Street, landscape screening and fencing requirements, and bicycle parking requirements. And then finally, a design review to comply with countywide design guidelines. The applicant proposes to construct a 15 megawatt solar energy facility located on approximately 65 acres of the 91 acre project site. Development of the facility would entail solar panels, associated power collection, a driveway from West 6th Street and internal access roads, and fencing along the perimeter of the project site. The solar panels will be dark blue or black and covered with anti-reflective coating. And then access to the project site would be provided by a 35-foot driveway from West 6th Street. From the driveway, the internal access roads would be 20 feet wide. Along the project site's frontage with West 6th Street, a 7-foot tall tubular steel fence would be placed behind a landscape planter area, ranging from 15 to 45 feet in width. The proposed landscaping along West 6th Street consists of densely planted shrubs ranging from 5 to 8 feet in height. The shrubs would be located on a raised berm, approximately 2 feet in height, with clusters of deer grass, bark mulch, and seeking areas would be located behind the shrubs in West 6th Street right-of-way. I should mention that there have been some concerns that have been brought to light about landscaping, particularly with landscaping for this project in relation to other solar facilities. I think that we have learned quite a great deal with the maintenance of some of those other solar facilities, and that has been taken into consideration in developing what we believe to be a far superior landscape approach with this facility, with the use of quite a significant amount of bark mulch, the berming, and a densely planted landscape material.
Supervisor Natoli?
Yeah, thank you, Mr. Chair. Chris, while you're on that slide, and I know I raised this in my briefing, and knowing that in one of the rounds when SMUD went out for the smaller solar generation sites, many of them were placed throughout the South County, and I've commented before that the landscaping on some of those was sketchy at best, and the maintenance of the landscaping once plantings either died or didn't perform as you might expect, there's been negligible, if any, aside from cutting weeds and maybe making sure that the irrigation to those shrubs that were planted. And in fact, we didn't get a chance to see those because of the way the zoning code was at the time, and certainly Leanne, I don't know if Chris, you were with the planning department at the time, would recall. And it continues to be a concern. I don't know that it's a zoning code compliance. Again, they may have put the plantings in, but the maintenance has been, I would just say my word's less than stellar. The ability then to follow up with those properties get sold. They may have underlying landowners, but then the leases get sold to companies in Texas or New York or New Jersey or wherever else it's at, and trying to track down responsible parties for assuring that landscaping is maintained. I'm not suggesting that's what's going to happen here, and I think your comment obviously went to, what was being required. I will just also note, and I don't know if you're going to cover it, you talked about the 7-foot chain link fence, but one of the requirements that I believe the commission imposed, we talked about this at the board when we talked about some of the guidelines for considering these, was that particularly when you had outward-facing exposures or adjacent to homes or even ranches, ranch homes and so forth, that we look at vinyl coated either green or brown. I think it was suggested in here that maybe even something similar to what's used in the Parkway and some of the interfaces there. I didn't see that as being a part of the condition. You're just going to let them put up the regular steel and clad chain link fence, and that was a consideration, and I think the planning department has recommended that in the past. Maybe that's what you're recommending here, although I didn't.
There are two types of fencing that are conditioned to be approved with this project. There is tubular steel fencing that will be installed along West 6th Street, north up to just about the terminus of West U, and then the chain link fencing would be around the remaining perimeter of the site. But tubular steel fencing would be installed where it is visible.
What color is that? What color?
We do not have a condition related to the color of that fencing. I believe it's black.
Okay. And the chain link will be just your regular
Right.
silver color chain link?
Currently, that's what.
Because I know we had some confusion even with one of the projects in my district that they ended up putting the wrong chain link in, and they were very reticent, but we did make them to comply. They had to actually pull the chain link out and put in what was called for in the conditions of approval that went before the Planning Commission at the time. So again, I'm not suggesting this applicant is in any way responsible for any of those, but again, I've made my comments known in the past that we could have done a much better job on some of those that we never saw back before the board that are now in my district, and some of them look great. Some of them have a wonderful job in landscaping. The fencing's been maintained. In other cases, you wouldn't want it in your front yard.
Right.
Thanks.
Just wanted to highlight a few of the key points for the project. The request is consistent with policy documents, including the general plan and community plan. Findings can be made to support the special development permit requests. It is, as I noted earlier, it is compatible with surrounding uses. And the environmental coordinator did determine that the prior environmental documents prepared for the prior North Sacramento solar project remains applicable to the current project proposal. An addendum to the prior document was prepared to update existing conditions where new information was available and to disclose impacts from the project's modifications. The addendum identified that the project would not result in new significant environmental effects or a substantial increase in the severity of the previously identified effects. The addendum concluded that the project would result in less than significant impacts to air quality and biological and cultural resources with the implementation of revised mitigation measures. The project was reviewed by the Design Review Advisory Committee, the Rio Linda Alberta CPAC, and the Planning Commission, all of which are recommending approval. And this final slide includes staff's recommended actions for the board to consider. This concludes my staff remarks, and I'm available as well as the project applicant to answer questions.
Thank you, Chris. Any questions for staff? What's that?
Is there any public comment?
No, but does anyone want to comment from the dais? If not, there's no public speakers on this. Is there a motion?
I just want to weigh in and say that the applicant went out of their way to take care of all the requested mitigation, and I had a chance to meet with them and also with Leanne Moffett, and I think it's a great trade-off for use of that land, and so I move approval.
Second.
That's been moved and seconded. Please vote.
Unanimous vote.
Next item, please.
We have a 3-minute, 4-minute.
Can we do our appointments?
We already took the appointments this morning.
Okay. Well, I do have off-agenda speakers, so we'll take them in the order that the speaker slips were submitted. First, we have Leanne Glambin.
Metro Cable, we're not doing Gramercy just yet. Metro Cable.
You can, whoever's in the back, if you can please
Screen.
turn off the
There we go.
PowerPoint. Thank you. Go ahead.
Hi. So I have a letter that was presented at the Sac County Behavioral Health MHSA Steering Committee, the February meeting, and would like to read it here. It's concerning the African American Trauma Informed Services RFP that's been delayed, and there are 10, I'm one of 10 community members that have signed on to this, and I won't read all of it in the interest of time. Dear Dr. Quist and Sacramento County Behavioral Health Services leadership, after attending and debriefing the MHSA Steering Committee meeting on January 16th, 2020, we, the undersigned, have composed this letter to provide formal feedback on the MHSA funding to support the Black community in Sacramento. And again, I'll skip over some things. We have concerns about the arduous and fraught process for this RFP for Black community-based organizations to serve the Black community. It appears that the release of other RFPs have been expedited by comparison. Furthermore, the sparse updates on this RFP do not inspire confidence in the process in the county's commitment to serving the Black community. We need appropriate funding for the RFP, inclusive eligibility criteria that allow small community-based organizations to lead the work, options for single organization or collaborative projects to be funded, and transparency in the process of developing the RFP, including standardized methods for collecting and analyzing community feedback. Item number 1, appropriate funding. While we are pleased that the award amount has been increased, it does not reflect the unanimous agreement that a larger budget is required. Given the ample MHSA funds are available, and given the demonstrated need in the Black community, shortchanging the budget for this RFP is unacceptable. At minimum, the needs of the Black community demand $5 million in startup funds and $3 million per year thereafter to sustain culturally responsive wellness investments. Number 2, inclusive eligibility criteria. We strongly recommend removing the technical requirements for organizations to have 45 days of working capital and to have had a financial audit in the preceding 24 months. There are alternative methods to ensure that the awardees will be fiscally responsible that are not rooted in structural economic inequity. The irony is that structural oppression is the root cause of the disproportionate trauma in the Black community that the RFP is attempting to address. If the goal of the RFP is to support the Black community, the commitment should extend to the execution of this RFP. However, if the county insists on retaining these technical requirements, it should also commit to providing grantees with multi-month funding for an audit, appropriate indirect funding that includes operational expenses and technical assistance to build organizational capacity. Rendering otherwise qualified applicants ineligible is counterproductive. And I can see the time is up. You have the letters. Just in solidarity, the individuals who signed on to this letter: Ebony Chambers, Flo John Kofer, Michael Kraft, myself, Lillian Glambin, Christy Hagans, Adele James, Ryan McClinton, Leslie Napper, Danielle Prince, and Doretha Williams-Flournoy. Thank you.
Thank you. Supervisor Tully?
Yes, Mr. Chair, I know we can't take any action on this, and I appreciate Leanne being here today. We received this letter a few days ago. I guess just for information's sake, and I don't know if this got referred by any of the offices to the county executive, but I think some of the same challenges we had with the Black Child Legacy project as it related to 45 days of working capital and so forth, we were able to address that, I think, recognizing the strength of community programming. And so I guess I would hope that as part of this, we may have a standard RFP process, but that our folks would take that into consideration. So I would just offer those comments.
Thank you.
Thank you.
Thank you.
Thanks, Leanne.
Okay, Eric Gale.
You have a problem in Sac County where your sheriff department photoshops people into stealing crime so they can blackmail them for some kind of weird race where they're running people over with cars. Now, I don't know if you heard anything about this. I'm just trying to give you a heads up because the feds already know about it. You guys need to tell your people to stop trying to run me over, for one, because it's not going to happen, because I don't want to hurt anybody out there. So it's out of your hands anyway, but please tell your officers to stop trying to run me over and stop running over other people who are on welfare, because There have been people who've been hit 4 times by cars, and they're all they're in formation, like they Bob Bondurant or something like that. And it's not right. You can't have a START chamber in Sac County, or can you?
Thank
That's
you,
all I
Mr.
got to
Gill.
say.
Thank you.
Feds will talk to you later about that.
Thank you.
Thank you.
Okay, that's all I have for off-agenda speakers at the moment. I believe we can, is it a 215 item, right?
Yeah.
Yeah.
So item 35 is the Gramercy Use Permit Amendment, an amendment to use permit and design review to allow 30 additional skilled nursing beds for a property located at 2200 Gramercy Drive in the Art and Arcade community. The environmental determination is exempt, and Chairman Cerna, we do have to take an oath if there are public speakers on this item.
So who's expecting to speak? All right, our clerk is going to administer the oath.
Okay. Do you swear that the testimony you're about to give this board is the truth, so help you God? If you do not swear, do you so affirm?
I do.
And when you get to the podium, please state your name for the record and the statement I have been sworn.
Chris?
All right, good afternoon. Chris Pahuli once again with your planning department. The Gramercy Use Permit Amendment Project is what I will be providing the staff comments on. The subject site is located at 2200 Gramercy Drive in the Arden Arcade community. The property is currently developed as a 175-bed convalescent assisted living complex. The request for board consideration is an amendment to the existing use permit, which would result in an increase in assisted living beds from 55 to 85, and modifications to conditions related to pedestrian access. The request also includes a design review to comply with countywide design guidelines. The project site was developed in 1991, consistent with requirements at the time, with a 175-bed convalescent assisted living complex comprised of 120 beds for the convalescent component and 55 beds of assisted living. The use permit amendment would increase the number of assisted living beds to match the applicant's state permit and would result in a total of 205 beds for the facility. 3 more employees are proposed to serve the residents, which would result in a total of 170 employees that work over the course of 3 shifts. I should note that there have been neighborhood concerns related to parking and the number of beds. To address some of these concerns, the applicant will be conditioned to lease off-site office space and 36 parking spaces at 2775 Cottage Way. They will also use 12 on-street parking spaces on Gramercy Drive for visitor-only parking, and they have a parking management plan that they will be conditioned to comply with. I'd like to dive into the parking requirements in a little greater detail. This table provides an overview of the parking requirements and is included in your staff report package. When the project was originally approved, the zoning code required 1 space per 3 beds with no employee parking requirements. The project was required to have 58 spaces, which they exceeded by 7 spaces. The middle column shows the existing code requirements, and under the existing code, the project is short by 49 spaces due to the added requirement in our zoning code of 1 space per 3 employees. The final column, or the column to the far right, shows under the current zoning code with the request. And the applicant is requesting, as I mentioned, to add 30 additional beds and 3 additional employees, which would mean that 60 additional spaces would need to be provided. The applicant is accomplishing the parking through 77 on-site spaces, 36 off-site leased spaces, and 12 street spaces on Gramercy Drive. This visual shows the 77 on-site parking spaces on the left and the leased and street parking spaces on the right. Should note that the applicant proposes to use 12 of the 24 spaces available on the west side of Gramercy Drive for visitor-only parking. Also, staff evaluated the parking calculations at 2775 Cottage Way to ensure that the reduction of 36 parking spaces would not negatively impact the office's parking space count. Want to review some of the proposed conditions that have been agreed upon as part of the project with the applicant. Condition 20 is modified to require that pedestrian gates to El Prado be emergency egress only, which I should note was a concern of some of the surrounding residents. Condition 23 requires the 36 off-site parking spaces. Condition 24 requires the applicant to maintain those leased parking spaces and provide a copy of the lease to planning. Condition 25 requires the leased office space to be used for storage only, as to not impact the center's parking situation. And condition 26 prohibits employees from parking on Gramercy Drive. I'd also like to point out that during briefings, a question came up regarding fencing, and there are references throughout the report package to fencing concerns. The complex currently has a solid wood fence along its perimeter, which it was conditioned to install and is consistent with current zoning code requirements for industrial uses adjacent to residential uses. Staff inspected the condition of the fencing on at multiple site visits and found that the current condition of the fencing to be acceptable. Therefore, no modification to conditions or no new added conditions were added to the project by staff. The request was reviewed by the Arden Arcade CPAC and the Planning Commission. At the Arden Arcade CPAC, which occurred nearly 9 months ago, members of the public expressed concern with parking, fencing conditions, and operations of the facility. The CPAC recommended the board deny the use permit amendment. Following the CPAC meeting, the applicant sought to address community concerns by leasing additional parking at Cottage Center and reducing the reliance on street parking, which was a major concern that was brought up at the CPAC meeting. When the request was heard by the Planning Commission, it was in the current configuration of the project before you this afternoon. There were members of the public that spoke in opposition to the request at the Planning Commission meeting. However, the Planning Commission recommended unanimously that the board approve the use permit amendment. Just to summarize the recommended actions that are before the board, it's to recognize the exempt status of the project pursuant to CEQA guidelines, approve the use permit amendment subject to the revised conditions, and then find the project in substantial compliance with the countywide design guidelines. That concludes my presentation. I'm happy to answer questions.
Okay, any questions for staff? Okay, I have no one sign up to speak on this. Does the applicant want to address the board?
Mr. Chairman, members of the board, Marcus Loduca and I have been sworn. On behalf of Gramercy Court owner-operator Generations Healthcare, I'm pleased to be before you with the recommendation for approval from your staff and the unanimous recommendation of the Planning Commission for what is a relatively minor change to the operations of the Gramercy Court project. Again, staff's presentation, the staff report, both to the board and the Planning Commission, did a very thorough job of reviewing the project and summarizing our request. So I just want to highlight a few points if I could. To begin with, Generations Healthcare became the owner and operator of the facility in July of 2016, investing $4 million in improvements and renovations to the site, and also recently replaced 95% of the perimeter fencing around the project. So no new construction is involved with the project before you. As the staff report has noted, the project was originally permitted by the State Department of Social Services for 85 assisted living beds in addition to the 120 skilled nursing beds. And that's how the facility was constructed and opened starting in the early 1990s. Since my client has owned and operated the facility since July of 2016, they've never had more than 55 assisted living residents at the facility. So the request today is really to match the use permit with the state license that has been in effect for 30 years. I would note that our assisted living beds are all full, and there is a waiting list in the assisted living facility, a portion of the facility. The unique aspect of the project before you today is that the conditions of approval requiring additional parking have already been implemented. Beginning in May of last year, we had 2 neighborhood meetings that were noticed 2,000 feet from our property, and residents expressed concerns regarding employees parking in their neighborhood. So what we did at that point was to lease 24 spaces in the office building next door in their parking lot, and then through enforcement of a parking management plan that has been strictly enforced by the facilities administrator, Dan Bushnell, was to get employees assigned parking in those 24 spaces. And then starting at that point in the middle of last May, we started getting emails back and forth from neighbors relative to the effect of that additional parking and what effect that was having on parking in the neighborhood. By the end of May, through a series of emails with neighbors to the project, we found that it had addressed the concerns of people parking in front of their houses. And so those concerns have been addressed by, again, that parking management plan that's described in the staff report, as well as by the enforcement by the facilities administrator. Then we went to the CPAC last June. Staff mentioned the CPAC recommended denial principally on the basis that we had employee parking on the street, even though that is allowed by our current use permit, it's allowed by county code. And following that CPAC meeting, your staff asked us if there was anything we could do to acquire additional parking so that there would only be visitor parking on the street and not employee parking. So then my client went out and got 12 more parking spaces in that parking lot. Again, those spaces are assigned to employees, and we do lease space in that building, but it is not for employee use, it's only for storage. So now with the 36 spaces, we have the 12 on-site or on-street parking spaces for visitors for the 30 additional beds, and we need 3 new employees to be able to serve those 30 new beds. Under the current code requirements of 1 space per every 3 beds and 1 space for every 3 employees, we would need 11 new spaces, and we're providing, again, we went out and got an additional 36. The condition 20, which has, since the start of the project in the late 80s, has required those pedestrian gates at the rear of the project to be open. Our neighbors expressed concern that that was basically allowing employees to park in the neighborhood and then be able to access the facility through those gates. So we're in agreement with our neighbors and ask for a modification to that condition to have emergency egress only, and otherwise those gates to be locked. My client is also eliminating outpatient services, including physical therapy, and there were in the original 1987 use permit 10 daycare beds that were allowed, and we're eliminating those also. So again, the facility's been operating for nearly 30 years with the uses permitted by the code. I know there was concern expressed at our neighborhood meeting and at the CPAC and at Planning Commission about the original approval by the board in 1987. That issue is moot. The facility is open. It's operating. Our proposal meets all code requirements now on parking. Even though we are not changing anything in any way with the skilled nursing portion of the facility, the overall facility, both assisted living and skilled nursing, meets county code requirements. If you listen to those who are asking for denial, what you're saying is those spaces go away, the gates remain open, and the issues and the concerns and the problems with employees parking in the neighborhood that our neighbors were so unhappy with comes back. We've addressed those concerns with the plan we have that's in place now, and so with that, we would ask for your approval today of the project as presented and as conditioned by your staff and the Planning Commission. I'm here to answer any questions you may have, as well as the Facility Administrator, Dan Bushnell. Thank you, Mr. Chairman.
Thank you, Mr. Luduca. Any questions for the applicant? Okay, thank you. Again, I have no one signed up to speak on this. Supervisor Peters?
Anybody on the board that wants to make comment? Okay, all right, well, I am, this is a facility, piece of property that I've been a lot of questions on since I came to the board, and there hasn't really been any way to fix it because they've been going on since 1987, 30 years plus of usage, and I think this application really cleans up the questions and concerns of the neighborhood. The gateway problem is fixed by making it available for emergency use only. The parking, which has been probably the biggest concern of the neighborhood, by leasing additional spaces and moving various usages of those spaces around, I think it solves a problem, and it's actually been, the condition has been being used for several months already, and the complaints we used to get have stopped from that. The fence is being replaced, so I think that issue is taken care of, and I wanted to say congratulations to both the applicant and planning for coming up with condition 24, where prior to the expiration of the lease for the off-site parking and office space, that the applicant has to provide a renewed lease, or if it doesn't happen, the use permit amendment will expire. So I think that kind of puts a bow on the parking situation. This facility gets a lot of use, and is important to have projects like this in neighborhoods where people can go and recover from surgery and other issues close to home. So we did have one letter come in from Michael Seaman, for the record, and he stated that his two main problems were the pedestrian gates closed, which has been done in that they're available for emergencies only, and mentions the parking spaces, which I think leasing the 36 additional spaces fixes that problem. So I do move for approval of the project under the staff recommendation, and
Chair
thank
will
you
second.
to all.
Okay, it's been moved by Supervisor Peters. Chair has seconded. Please vote.
Unanimous vote.
Thank you. Thank you.
Mr. Chair, our next item is at 2:45, so we have another break.
Okay, we will recess for 10 minutes and come back at 2:45. Okay, call back to order this meeting of the Sacramento County Board of Supervisors for Tuesday, March 10th, 2020. Madam Clerk, will you please call the roll and reestablish a quorum?
Supervisors Frost. Here. Kennedy.
Here.
Natoli.
Here.
Peters. Cerna.
Here.
You have a quorum.
Great, thank you.
Okay, so item 36 is to authorize the Department of Waste Management and Recycling to increase tipping fees at Kiefer Landfill and North Area Recovery Station, and proceed with all necessary actions to comply with Proposition 218 requirements for adoption of the proposed solid waste residential rate increases.
Chair Cerna, members of the board, thank you for this opportunity to address the board today. We're here today requesting a rate increase for both our facilities and the residential collection rates. Much has changed in the recycling and organics world affecting our department since the last Board of Supervisor approved rate increase for facilities in 2008 and the last residential increase that was approved in 2008 and effective through 2010. The department has taken many measures to change how it's done business, to become more efficient, to be very innovative in our programs. And as a result, we did build up reserves over time for the activities that we conduct, as well as our capital needs. Just a little history. Back in 2006, California passed AB 32, which was the California Global Warming Solutions Act, and they delegated the authority for methane gas to CalRecycle. In September of 2016, SB 1383 came into play. We've made a couple of presentations to the board. I believe it was March of 2018 and February of 2019 on the impacts of 1383 and how we think that will impact the residential rates. And essentially, the 1383 mandates the eventual elimination of organic material from our landfills. It also requires us to collect food, waste, and organics at the curbside. And we'll talk about some of the changes that's going to propose. And one of the other big things that's affected our industry and our department, in 2011 and again in 2013, China had what was called Operation Green Fence, and it was a restriction they put into place for recycling materials entering China, essentially trying to get rid of or establish thresholds to eliminate trash that was being sent to China. Those changes ultimately came in, I think it was 2017, China actually started enforcing that, and it really changed the recycling market, made it very difficult to get rid of recycling materials. And we've talked about some of the challenges we've had on the recycling processor contracts, trying to get rid of materials and the change from what used to be a net revenue to us to a substantial cost to us going forward. Today, I'm here to strike a balance between really 4 different areas. The balance is to keep providing the best service possible, to protect our environment, to keep our rates as low as possible, and have a strong balance sheet and financial statement as we go forward. And that is a balance. And as we go through today's presentation, there are impacts to different scenarios. We do, as part of 1383, we will need a new building up at NARS for processing organics. We are going to be adding 15 routes, essentially 18 trucks. In the financial models that we have here, we have actually gone from where we have a capital reserve that's paying for those to a finance model, and that helps in our rate stabilization as we go forward. But the whole balance of trying to comply with 1383 with the recycling markets in today's world is really it's an interesting, but it's a difficult balance at times. So today, just as an overview, basically we're here because of 3 things: change in the recycling markets, change in the organics markets, and compliance with state laws and regulations. That would be AB 32 and SB 1383 that directly affects landfills and organics. The proposed residential rates, we're looking at, and we're coming in a 3-year rate request, essentially a little over $12 July 1st, followed by $3.50 or so the next year, followed by almost $2 the next year, just to give you a sensitivity on where we think the rates are going as we add in our new programs. The last rate increase on the residential, the board approved back in May of 2008, a 3-year, $1 per year rate increase for 2008, 9, and 10. So our rates have been unchanged on the residential since 2010, and we are very proud of that. We are probably one of the only entities in the area that has been able to maintain those rates. On the facility, the last facility increase was 2008, and we're looking to increase the per ton cost at NARS to $48 a ton, and Kiefer going up to $43 a ton. And again, it's been 12 years since that rate was adjusted. When we talk about curbside recycling, I just graphically wanted to show you and the audience. We went from a money generating scenario in 2015, and all the slides we have are 15 to 19. So we were collecting $26 a ton in 2015, and now we're paying $72, and we project that number will continue to go up. There may be materials that we currently are putting in the program that we may have to eliminate to help control that cost. It doesn't appear at this point that we'll be adding a lot of materials that have any value to it. On the green waste side, we've gone from a cost per ton of $11.75 up to almost $60 a ton now, and when we add in the food waste starting in January of 22, we project that number will be close to $90 a ton. On the facility side, we have been working with a master plan for NARS. Essentially, we are the lowest provider of refuse for small vehicles, pickups, cars, vans, that kind of thing. So we get the majority of the public through our transfer station. We have extremely low rates. We're $20 for a pickup load. That has resulted in the last couple of years with not only a steady increase in volume of cars and tonnage, but we actually have had some problems keeping the crowd off of Roseville Road. So we recognize that we have to make some changes, and we're in the process of designing some roadway changes to change an entrance, add an entrance onto Roseville Road, an exit onto Roseville Road to try and improve the traffic. Included in there would be a new road that would add a commercial traffic, so we can get the commercial vehicles off before they get into the queue with everybody else right now, and adding a couple of scales on site. That is all funded with today's operations. We also, as I mentioned, need to add in the new organics building. So under 1383, we're required to collect food waste at the curb. We currently put our green waste in an open air pad that's uncovered. We can't continue to do that with food. It has to be in a controlled atmosphere, and so this proposed building would be approximately $35 million. It would be paralleling the railroad tracks on the south side of our facility. It would have 4 back-end bays for transfer trucks. Think of it 2 for solid waste and 2 for organics. The air in the building would be captured so we wouldn't emit odors into the community, and the idea would be drop on the floor, push in to a transfer trailer, and move off site quickly, and that should help us with both odors and flying material that we have a problem with now. The facility is similar to one that's down in Puente Hills.
When does construction start on that?
We haven't started construction on that yet. We will have to come back to the board. There's an item, number 7, that's after us today that has to do with the architectural contract for that, to keep that going. We need to get that building built in 2021, next year, so that we can take the organic material January 1st of 2022.
I'm just concerned about the odor there, and thinking of the Kohler place on Jackson Road that has the bad smells from the animals. It's got to be up there in comparison. The odors from they must be similar, smelling different, but being pungent.
The inside the building would have odors, but it has an air system that's capturing those odors and putting them through a filter system.
Yeah, but well, I think you'll need to keep an eye on it to make sure it's the latest technology.
Oh, absolutely.
Yeah.
Absolutely. And I did visit the Puente Hill site. I stood outside of where the transfer trucks were at, and to be honest with you, I couldn't smell anything.
I guess when you said the trucks would back up and dump the waste, I'm picturing it being open air.
No, they're dumping inside, inside an enclosed building.
They go inside the building, the door shuts, they dump the load.
They can dump the load, and then they push it in, top load into trailers that are on the bottom side that back in.
Okay, thank you.
1383, residential collection at the curb. We do need the enclosed facility, as we mentioned. And part of what we're trying to do with this building would be separate the public from the commercial vehicles. We have some safety issues with all the traffic, and commercial drivers approach their job very different than the public when they're backing up into the areas. We've had some issues there, so we want to separate people. And then for 1383, Kiefer landfill, no organics allowed for disposal after January 1st of 2022. This is simply a slide that shows under 2 of our scenarios where the reserve balance would be, and we're just graphically showing that if we don't do anything at all, we will be in dire straits at some point. Just a breakdown of the cost for you, the operating costs since 2010 and over that same time frame, if we were looking at CPI increase, it was 30%. but we broke down the rate. It's $4.71 for the operating costs that we've needed since 2010. Your disposal on the organic side, the green waste side, that equates out to $3.56 per month per household. The recycling market cost is $2.01, and then we have the capital replacement and the startup costs. And that concludes my portion of the program. I do have, we hired Hilton, Farnkoff, and Hobson. I have Marva Sheehan here today. We engaged them to put together a rate study for us and the rate methodology, and we'd like her to explain the methodology, how we arrived at the numbers that we did.
So, Doug, before you leave the podium, and I know Supervisor Natoli has some questions here too. I don't know if you made mention of it. I did have to step away momentarily, but you mentioned, I believe you said it's a $35 million new building for the food waste.
That's what we're estimating.
Handling. Is that a type of facility that each of the 58 counties is having to consider either building from scratch or retrofitting existing structures? Is that a capital facility cost that is going to be common to all agencies that handle solid waste recycling?
There are jurisdictions that have transfer stations, but they have the same problem that we do in that if the material's not in an enclosed area for the air containment and the odor containment, they're going to have to put in a facility like this. Or your other option is you direct haul the trucks. So if I had another facility, let's say in Sacramento, and it was a compost facility and I could direct haul my trucks there, I wouldn't have to transfer the material and I wouldn't have to necessarily put in the building.
Okay.
Does that answer your question?
Not really. What is Santa Clara doing? What's Alameda doing? What are they investing in new buildings or not?
They have.
Okay.
Oakland for sure has, but they've done it in the Bay Area. They've done it for a lot longer time.
Okay.
Because if you think of Oakland and San Francisco, there's not a lot of green waste.
Yeah.
So they've already started a lot of their residential food collection programs.
Okay. And then when you and I met yesterday, in the briefing on this subject, I had asked you specifically to please make mention of our program that has been in place for some time now to address lower income households or fixed income households, and how we mitigate the impacts of fee adjustments that are proposed like this that are not insignificant, and how we protect those parts of our population in particular.
So, and I was going to cover that.
Did I beat you to your punch?
That's okay. It's okay. It's a perfect time.
Okay.
So when we calculated the rate, you have a handout in front of you that I added. This was some information that we created in the last week or so. And it does have down there the proposed lifeline rates. If you'll remember, the rate for service is offset with a rebate that comes via the SWA to the county general fund. Mm-hmm. And so we have the current rates down here, but my desire would be to increase the SWA contribution to the lifeline rate so that we can keep the lifeline rate at the basic rate that it is today. By increasing the SWA contribution to the general fund that comes to those folks to keep their rate down. So currently they're getting $5 a month as a rebate. That number would go up by, I think it's $7.
All right, thank you.
Just because I want to keep that. The other piece, and I appreciate your comments yesterday, because we had not really prioritized the advertisement of that program.
Yeah,
and
so we need to do a better job of letting people know it exists and how to
Yes.
access it and what to do to
Yes.
take advantage of it, right?
And we are going to do that.
Good. Supervisor Tully?
Thank you, Mr. Chair. Doug, I know you've got another part of the presentation, and certainly I won't get ahead of you on that. It was included with our packet, and I have more questions when I guess we've all got a chance to hear that. But a couple of things, just certainly to, and again, this is not to, hammer the messenger here, being you, and certainly to acknowledge the changes. But as you kind of characterize this, striking this balance, I think part of what this board, and certainly I'll speak for myself, board member looks at striking that balance is, what's before us here. Granted, we have mandates and we have responsibilities that go with, the sanitation, public health component of garbage collection, disposal, and all the various attributes and components of that. But what we're proposing here, what you're proposing to us to take out to people largely in the unincorporated area of the county, is over a 3-year period of time, more than 100% increase over current rates. But there's another factor here, and you and I talked about this when you briefed with me, is that in addition to that, we have a service reduction. Because right now, and we've pushed this for many years, additional recycling cans and additional green waste. So starting year after next, under this proposal, we start charging $8.79 for that can, up to 11 and some change. And so when you total all that gets to significant increase. And you talk in the case of a CPI, 30%, you're 50% plus with what's before us to take out to folks. And I just got to say that there's a lot of factors in here, and we talked about some of these, and certainly it's not surprising to you, but when I look at the folks that, all of us represent, but I'll speak for the district I represent, this is significant. And you look at the bill, I know there's a water rate increase that's been pending. We've been briefed on that previously. I didn't see any information and I mentioned this in our briefing with Mr. Hartwig about that. That's been talked about at the board. But I'll speak for particularly customers who receive one bill from the county, largely in the Vineyard area, that have a county water bill, they get county garbage collection, and they get sewer from sanitation district. It doesn't show a different water district, a city of so-and-so or one of the private water entities. It doesn't show a different residential garbage collection service. And so there's no blaming, well, so-and-so raised the rates. It all falls right here. And certainly Supervisor Kennedy and I, we shouldered most of that. And we have control. Those are the only rates we have control over, and yet we have the responsibility that goes with all that. I guess my point being here is that if I heard you correctly, you said we have not raised tipping rates at the landfill in 13 years. Is that what you said?
Since 2008. So
if you're anticipating some of these changes becoming along, there are costs associated with that to commercial as well as to other residential customers. If I've heard it once, I've heard it 100 times before this board about, and I even repeat it now, that the landfill is an asset. So if we're managing the asset, and again, long before you came to the county, and we lived 13 years where you had the ability to control what comes to the gate, what you charge for, not only to address that sunk asset and all that goes with that, and I see in this rate component, and the analysis was done by the consultant, you're allocating these costs. So some of this we knew was coming down the pike. Why wasn't solid waste here, at least on that piece of it, earlier?
So that's why I wanted to highlight AB 32 and 1383. The recycling changes that came into play and cost us. If you go back, I don't have access to the PowerPoint, but our curbside recycling chart here, and we went from collecting $26 per ton.
In 2015, but warning signs were already there by 2015.
Right. But we had significant reserve balances. We are in the process of completing the board-approved the road perimeter project at Kiefer Road, constructing a new module 4. That's $45 million in capital. And all of that we had in our reserve balance and did not impact the rates when we started that project. I think it was 2 years ago. So we've managed our money and built up a reserve and then started using the reserve. Most of the reserve was built for capital projects. Liner systems at the landfill, $45–50 million. Those are very expensive things. We have self-paid for our replacement trucks and any new growth trucks. All of that has come out of operations generated funds. We got to a point where if I come into the board in 2017 and said I needed a rate increase of $2 a month or $3, everybody would have looked at our balance sheet, the reserve balances, and everybody would have said, you need to work those reserves down to another level before you come.
But you're talking about now financing, and I get it because you can pay as you go versus having to bond for it, a $35 million expenditure for for the NARS. And I get it. That needs to be done if you're getting, producible types of mixtures with your green waste, and you're dumping that out there, or, in all different type of weather conditions and the volumes that you go through there. But we're seeing more than 1 million tons a year coming into Kiefer.
Yes.
And you knew that you're going to need something of some sort. I'm not talking about on the residential side that has some effect. The tipping costs, I guess we charge ourselves internally for that, and if not, then we offset it. But why with the Kiefer? I'm talking about the tipping fee versus the residential collection. Those are two separate things. They may be interconnected, but that was my question to you.
Okay.
The landfill, a publicly operated landfill that takes in commercial as well as residential and even out-of-county waste. We have the ability to charge whatever the going rate is, certainly be competitive in the marketplace, and recognizing that has impact to businesses and to some of the folks we here in the audience that do business that with the county. Why weren't we with that piece of it? That was my question. I'm not talking about the residential rate piece. I'm talking about with the Kiefer portion of that, particularly when you're looking to fund these improvements, because now you're asking residential customers on their backs to pay another $2 a month out of this component, at least in the initial rate, just to help finance the new building. If I'm not mistaken, that's what you just said, and I think that's what I read in the report.
Right. So the new building is at NARS is a combination of needing it for our growth that we've had at the facility, as well as the new organics. And collecting and transferring the organics in within the permits that are required for air quality and things. We had the same issue at Kiefer in terms of if we had come to the board a year ago or 2 years ago and said we needed a rate increase, we still had a lot of reserve balances. That would have been a question in terms of whether we really needed the increase. Number two, the natural question would be, what's the impact going to be on the residential rates? And we didn't have those answers until just recently.
So what's the component that comes out of the residential rate that is being presented to us today that's attributable to the tipping fee that I guess we control? I would assume we could control the tipping fee. We could charge ourselves the same tipping fee if we wanted to for county residential collection, the 162,000 counts that we service. Right? We could charge ourselves whatever we want. We could give ourselves free pass. I mean, there's nothing free. It's going to have a cost associated with it. But we have the ability to do that, do we not?
I believe so. You know what sorry, Marva?
Okay, well, she can cover that. But I guess part of what I see here is, you're asking us to go out to the residential customers, the 160,000 accounts, and with a more than 50% increase and about 120% increase if people have 2 carts, which we've encouraged them to for green waste. And that's important in a lot of the unincorporated neighborhoods because we want people to have kempt yards to do the right thing, not put it in their... that message has been out there for 20 years. Don't put it in your garbage can. Get a second green waste container. We'll offer it at no charge. If you need extra recycling, we'll provide those free of charge. I get it. Those markets have changed. The requirements have changed. But now we're telling folks, if you want those things, you're going to pay over and above an 80% increase in your rates over 3 years. You're going to buy those things on top of it if you already have them. And guess what? You're looking at, hundreds of dollars a year more to residential customers. And I got to tell you, that's a real hard sell for this supervisor. And when I got to go to neighborhoods, when I got a pending water rate increase that's out there potentially, and it's in a couple of other districts going to hit it too, those are significant hits. And, when we're looking at the ups and downs at market blips right now with, what's going on, I don't deny the obligations, but and you compress this into 3 years versus looking at something that's 5 or 7, looking at financing. I guess we have all those things to look at. And I guess one of the things I would note too is that, we're breaking the SWA up. This member disagreed with that. That returns $1.5 million or $2 million to the general fund. It would be my view that if we're bringing it back in-house, that rather than to keep monkeying with that in the general fund, we need to have a serious discussion, this board, as to whether it goes back into the refuse enterprise to offset some of what's proposed here, because the situation has changed as you clearly and accurately portrayed it. I don't think we can any longer afford to milk that off and then use it for all the other things that we have to provide for up here. It just seems to me that we're really hitting the residents of the unincorporated area very, very hard with these rates. And even with the comparisons that are in that report, and I'll let them cover that and ask more questions later, is we're going to be number 3 on that chart. as far as rates being high. And again, kudos to the department for management over the last 10 years and not coming to us when you didn't think it was appropriate. But I still think on the tipping fee that somebody should have been here before this board, at least talking to us, recognizing that you knew some of this stuff. I say people knew this was coming down. We didn't know what it was going to mean. But now we go out to folks and say, well, guess what? Starting July 1st, we're proposing to go from $23 to $36 a month, billed twice, bi-monthly. So you're going to see a $72, or $73 bill for your garbage service. And by the way, next year, you're going to have to turn in one of those green waste cans, and or you're going to pay $8.79 for that. And if you have extra recycling, you can pay another $5 on top of that. So that is a very, very difficult message to take to folks. And I understand the 218 process, and it just seems to me that thoughts about balancing this. What about the customers that we're all serving? They have no choice. They can't go anywhere else. They're under the state law and the county ordinances. They have to get their service from us. So they can't go out and shop the market. They're not like us, we're not like the other cities who've gone out to other haulers and said, give us your best price and we'll see how that factors out for the customers. We provide the service. We do a good job of it, but they have no choice. And so, they are a locked constituency when it comes to that. And to me, this is not. It's the largest increase, I'll say this, since I've been on this board, it's the largest single increase in any of the utilities that I've seen year over year in my 25 plus years on this board. And it's nice that we held them down for the last 10, but I think that, when we have an asset like Kiefer and we got residential customers that are going to feel all the impacts, and significantly to say, over 3 years, we missed the mark by a lot, some of it state law, but you're going to pay 120% higher increase for the same service in your rates. And that's my calculations. Again, you can pick that apart a little bit, but that doesn't seem reasonable. I'm not going to try to sell it to folks. I don't think it's reasonable, and we'll have that discussion here today. We've got to find a different way to get to this. So I'll leave it with that right now.
Okay. Any other questions for the time being? Did you want to introduce?
Yeah. So with that, I'll introduce Marva Sheehan, Hilton, Farnkoff, and Hobson.
Okay. Good afternoon. Thank you, Doug. I'm Marva Sheehan with HF&H Consultants. I'm a partner with the firm. I have my colleague Scott Holt, and together we've built and performed the cost of service solid waste rate study. So just quickly, we're going to talk about the process, looking at the fees. A lot of what Doug said, you'll see it again, but you'll be able to ask some specific questions. We'll talk about the comparisons, the rates, and then looking at your fund balance. Similar to Doug's slide, without an increase, the fund balance is projecting some pretty significant declines. Again, haven't had the increase. A lot of this is repeating since 2008. We're currently in the 19-20 budget. It has a $30 to $40 million deficit, so something needed to be done. And they are looking at debt financing for the capital improvements at NARS and the collection vehicles, as opposed to rate revenue for the full amount. So it'd be spread out over time. So again, just looking kind of at what the trending on the fund balance is. As you see, it just continuing to decline without a rate increase. So again, I don't want to feel like I'm somewhat repeating, but with the facilities and the needs at NARS for the organics building, and the improvements at Kiefer with landfill and module development is always very expensive. And this whole organics processing cost. With the organics and what you asked, yes, the Bay Area, there's been several facilities. Altamont Landfill has put in a pretty extensive facility there as well. So there's been a lot being done. However, there's still a capacity issue, and that's something that is needing to be addressed. And right now, because there's a capacity issue, the rates are continuing to increase. On the collection side, we're going to be going in order to get to the every week collection of organics. There's that increase in the operations as well as the capital cost. the recycling processing cost, where we used to get in that $20 to $30 a ton as revenue, it's now processing, and I'm seeing that consistent throughout the industry, and a number of processors and contracts are coming for special rate adjustments just because of the impact of China and the impact on the recycling markets. Then with the capital equipment replacement cost, and then built in through the residential rates are the increased costs at NARS and Kiefer.
Can I'm going to interrupt.
Sure.
Supervisor Frost has a question.
I have a question
Sure.
relating to your comment on those that are coming for potential rate adjustments. And I've had this conversation with some of our service providers who are handling the recycling, and basically they're saying that the market doesn't bear what we are willing to pay, or what our contracts are written up to pay. And this is something that came to us a couple years ago when China pulled out. We had all these contracts in place, and people were basically paying to pick up our garbage and going broke regarding this. Okay, so my question is specific to the contract, and this may not be for you, it might be for Doug. But number one, are these fee increases that we're talking about going to make whole, help ensure that everybody's made whole in this process? In other words, we can't expect people to pay to pick up, to take our garbage if they can't sell it, in Vietnam or Indonesia or India or wherever they sell it. If they can't sell it for the price that they're getting or paying, it seems like there's no flexibility in the contract, written into the contract, that can ensure that we can continue to do business as usual without having to go back for another RFP and have them pay to get out of their contract. So the question I have is, will this help improve that situation that we're having with the recycling and the current moving market? It seems like the market's moving. And, or do we anticipate that this is only going to partially manage that situation?
So this rate package contains the information that under the current contracts that we have with our two vendors, it does not provide for any other escalations beyond what's in the current contracts. If, in fact, we had to, or we did renegotiate the contracts, or changed or modified and the cost went up, that would come out of our reserves.
Okay, so, but if it was modified on the other side and they're having a situation where they are in a bind and they have to just get out of pay to get out of the contract, it's their loss, right?
They would give us notice.
If we can't pay to cover it, I mean, we're not obviously, are we paying to cover the delta between what they can? My understanding is that there are challenges in the world market in getting rid of this recycling waste.
Right. There are. And the way the RFPs were originally done, there was a processing or a handling fee. And right now I'm, how much? Yeah. How much was it? 100? So we asked for two things in the RFP. Sorry, I was checking
No worries.
one of their staff. We asked for them to set their processing fee, the handling fee for processing the material, and then we gave them the list of commodities that we wanted to include in our program, which was the same commodities that we're collecting in previous contracts. And they were asked to set the participation rate in terms of what they would collect in revenue from some of those materials. Clearly, there were some materials like glass that have no value, and now we're paying $20 a ton. to collect. So we wanted to continue recycling those materials, but it costs them to get rid of the material. In each of the two vendors, they set their own processing costs, they set their own market rate for each of the commodities. So they are, in my mind, experts in their field in terms of how they produce their responses to the RFPs. They had the ability to adjust either the processing cost or the market cost. Both companies chose different methodologies. One is struggling, I've heard, and the other one I've not heard from. But they set up that criteria and in that RFP process. Some of the things that we've been requested from the one vendor, we can't do without violating the RFP process. We would have to somehow cancel the contract and then put that material back out to an RFP.
But part of it can be, but this will help. This will help, but it won't make them whole.
If we end up paying more money to them, it's not in this rate package. And so until we came back to the board in 3 years for a rate adjustment, we would have to use reserves to cover that amount.
So there is flexibility written in the contract whereby you come back to the board for, to work with them on their contracts.
Sorry, I can come back to the board to present a new contract, right? A new RFP, a new contract, that kind of thing. But whatever the cost implication is, if it's more than what we're currently that's in the rate package, we don't have adjustability in the rate package to adjust the rate midterm. We would have to wait till the end of the 3-year period or whatever the board approves as a rate and then include those additional costs in there. And in the meantime, we would use reserves to cover that.
Right. Supervisor Frost, based on the public contract code, we can't do the amendments to the extent that the vendor is asking for under the current contract. So we would have to put it back out basically to bid or proposal. And then we could come back to the board with a new proposal, either with the same vendor at a new rate or with a different vendor.
So right now, I'm sorry, I just want to make sure I understand this. So right now, we are taking a loss, and this will help make us whole on this rate adjustment with those contracts.
This is covering our costs for those programs, yes.
It does not change anything for them.
It does not.
Thank you.
Supervisor Tolley?
Yeah, if I could for presenter. So you've got your reminder here about the last tipping fee adjustment. I asked a question earlier, but I want to actually bore into that because in your consultant study, you talked about the adjusted revenue requirement projections, and you heard my question to Mr. Sloan, why 13 years as it relates to the tipping fee, particularly at Kiefer, although we operate Kiefer and NARS and have operated them in concert. But if taking from page 7 in your report, you show Kiefer, even with the tipping fee increase, as still running with a shortfall in FYI 1920, 2021, 22, 23. And I guess it kind of goes back to my question to Doug earlier, but certainly to your rate projections here, that so you're still showing Kiefer, even with this, and again, recognize there are capital projects, but we know modules, they may go up in price for what we have to do to be environmental compliance. But it would seem to me that there were signals out there, and I don't know if your study showed this, it was my question to you. So in your look at this, looking in the backwards direction that your arrow is pointing to, did you pick up that there were signs that at least the tipping fee at Kiefer should have been adjusted sometime earlier? Again, that wasn't your recommendation, and that wasn't, we have a staff that manages this. So, but we're projecting these deficits out now. We can say how much we're going to run in arrears, even with a rate increase, a tipping fee increase. But looking back, wasn't there some warning signs?
Well, outside of just looking at the historical to project the forward, there wasn't anything that I would have necessarily evaluated the department on and anything like that. When you look at, with the landfill, their surplus shortfall is so volatile with when a module is developed, and so you're accumulating reserves because when you spend millions of dollars, it can go down quickly. And so you need to then, accumulate again for when the next module is coming up. So it's really hard, I think, on a landfill side. As you see, the 1920, just looking across, we're at the figure 1-4B, from a 2 million, 13 million, 2 million, it's real volatile based on when expenditures are going to be done. They did have, like when we were doing the fund balance projections, there was, at the end of June of 19, there was $93 million in the reserves. That sounds like a lot of money. And to Doug's point of coming back and saying when you have 93 million, however, as we're looking at some of this requirements, it comes down quickly, especially on the collection side, because when you look at it appeared as we were looking at the numbers that the landfills have been, in essence, paying for the collection cost in order to keep things and coming out of that reserve. So that's been going. We're now setting, we're setting rates now for the collection operations to be self-sufficient with funding coming through the landfill and the transfer station.
Well, kinda. Now we're going to break this out where, for a while the landfill was looked to be an albatross. Then it's been talked about as an asset for the last 20 years, and now it's kind of either or depending upon when those capital costs are required. But we know how much a module holds. There's a whole plant out there that's got 75 years worth of capacity, if not more, in it. Mm-hmm. And if we're taking in roughly, we knew when we got the city's waste stream back, we also can calculate to some extent with, I think, some accuracy. And if we're taking in 1,033,000 tons in 2018-19, then that tells you with the tipping rate how much money, and you also know how fast you're filling up. And and again, I think our folks do a good job managing it. This is not a criticism as much as it is that if it's that volatile, this just wasn't discovered when you did a study or when Doug came on as head of waste management and recycling. It makes me question, why not somewhere along the line didn't somebody come and say, okay, we're going to have these major expenditures, not knowing necessarily about NARS and what you have to do out there with that building, but Kiefer, which, and again, this county, again, we take the responsibility on. We also have to ensure that it's operated, but that should be a benefit to the customers and not necessarily stand alone and or be a draw from the reserves. Again, if we manage it in that fashion, and I guess I hear you saying maybe it goes back and forth that way, but when I now see that there's this deficit and that now you're breaking operations out and that residential is going to pay, collection is going to pay for pretty much all of its own, then tell me what the benefit is outside of controlling the waste stream and a bit of our own destiny is Kiefer to us then. Again, I've sat here long enough, we've had these discussions many times over the years about expansion and what it costs, and and again, I've settled that it's an asset, albeit the roads are littered on the way to the landfill. We've talked about that, but so what's changed, I guess, besides what you've already described, Doug, or for you as consultants and looking at this, that now you always know there's going to be these intermittent times when you're going to have to make those major investments. I don't care if we have $200 million set aside to do that, as long as you're not going to have residential rate impacts and that we're positive when it comes to offsetting some of the costs to the residential rate payers. What's changed? That's my question. On the landfill side of it.
On the landfill side, tonnage continues to go up. We've done what we can to change the cost model out there. We've gone to full maintenance leases on the yellow iron compactors, dozers, trying to contain costs. But landfills are expensive. We put in new wells, groundwater monitoring. It's a pretty complicated process with it. But in terms of what's changed, again, we were able to control costs up until the last 2 or 3 years. And if you go back to one of the slides I had earlier on, of the $12 and say 50 cents, $4.71 is operational cost. The rest is tied to the new programs, 1383, the organics, and the recycling issues. So if you separate out the rate in that way, we're coming to you for a $4.71 increase on the operating costs. And again, the rest of it's either based on market or SB 1383.
Just to be clear, so do we charge that tipping fee internally?
Yes.
We do. And what's the rate that we charge ourselves?
The model is built with the same rate that is being proposed.
Is that how the model's always been built, or that was the model you were directed to build as part of the consultant work?
I did not look at the prior model. That was the direction that we were given.
So have we always charged ourselves the same thing as you do outside customers as to our own residential collection? Have we always done it that way?
I'm sorry, I don't know, because that was done back in 2008, and we couldn't find any records from the previous.
So what if we ask you to run a model? It doesn't change what you're putting out as being cost, but allows us then to look at, and it may mean for a higher tipping fee, which has its own implications at the gate, but because we control the asset, so to speak, then we ought to be able to look at how we might be able to bring down some of the cost to our residential customers. But that's the base we answer to, in addition to obviously the commercial customers. But I'm just curious. It seemed to me like we had an internal rate at one time where we charged ourselves something less than what was at the gate.
I remember that too, but I can't tell you what those numbers were. I'm sorry.
Okay, that's all I have for right now. Thanks.
Okay. Does that conclude your part of the presentation?
No, I still have a few more.
Okay.
I'll go quickly here. This was just kind of how we built the models, which is looking at the expenditures and adjusting and working with the staff on coming up with tonnage projections. So, which is in your packet, the comparison on the tipping fees at NARS, and then also what the comparison of the tipping fees at Kiefer. And where we are in terms, and this is one of those cases where it's good to be at the bottom at the landfill in most cases. And then we have the transfer station, which is still less than the Sacramento transfer station. From the residential side, there, just to emphasize that it's different. It's not just garbage. That's usually what most people think about when they think of garbage rates, but we're actually collecting the three material types of the recycling, organics, and garbage or refuse. We were charged with establishing rates that would meet Prop 218 requirements and cost of service requirements. And with that, we went with the cost, as you mentioned, for extra containers, going on recycling starting in July and organic starting in 2022. Again, using similar data coming in, we take the rates, we come up with fixed, variable, and transfer processing costs to establish what it costs to collect each material type. We calculated that. We looked at the revenue projections based on subscription levels, and kind of a reminder that we talk about the two organic containers, but 2/3 of your current rate base just has one container at this point. And so when we do go to one, they'll be getting service every week, so there's not a reduction in overall capacity because they will be getting weekly collection. So as we looked at the projections going forward, we're looking at the standard. Most, about 2/3 again, of your residents have a 60-gallon solid waste cart. What the projections out for the rates going forward. And again, every week organics to begin January 2022 to comply with SB 1383. So here is just to look at what the components of the rates are. You have the collection cost, and this is really just to point out that there's other refuse-related costs that are included, such as the street sweeping, the HHW program as well. And as you look at those costs, you can see there's a differential because of that. We look at the cost on the refuse container based on the variable, based on your size of container. So there is a difference between the 30, the 60, and the 90. So this is a similar slide that Doug had presented. Again, we're looking at the operations cost of that. That disposal organics processing, that's the increase in the actual refuse and transfer rates, as well as the organics processing rates. And then it's about $2 a month as a result of the market's decline. And that's actually on the low end what I'm seeing. I've done probably now 6 or 7 special rate adjustments, anywhere from $2 per month up to $6 a month is what we're seeing, depending on the processors. And then the beginnings of 1383, because with an addition of the vehicles, you need to get them early and get them ready so that come January 2022, they can hit the streets.
Could I ask you before we leave that slide? So
Sure.
what the green box with the 2 exclamation points, what's that? What's that?
So what that's saying is we're looking at that 12, it's been 10 years since we've had a rate increase. So basically it's, that's how much per month that it's changed. So if we looked at it over that period of time, it would have been $15 a year. Had we done it every year, people would have seen about a $15 a month or year increase. So what we're trying to say is if you spread things over this 10-year period where they didn't get an increase, it would have been pretty minimal. And I know it's difficult because people don't usually remember when they didn't get an increase. They remember when they do get one. But that was kind of what we were trying to make a point here.
But it still exceeds the CPI by 20%. Over that 10 years. If you use the CPI,
yes.
backdrop,
However, there are components that are outside of the CPI.
I get that, but reference was in reports at 30% CPI, and then all the additives that add up to what's being proposed. Okay.
Correct. And here this is kind of watching on the fund balance with no rate or tip fee increase, and then with it. And again, we definitely don't want to be in the negative 184 range. One of the concerns we have, when you look at the overall fund balance, because of having your landfill, you have closure, post-closure, which is a required component of the reserve. So you look at your working capital and capital projects reserves, and then we did, based on industry standards, what a projection for working capital and capital projects reserves. So we're still, even at the 5 years, slightly under, but there's a plan that over time we would get to what we would consider the industry standards in terms of reserves.
Excuse me, Supervisor Natoli?
Yeah, just on that chart. So what are you using as the outside date? Because you use the same volumes per year, and I know we had 75 plus years of capacity out there. So what are you using as your target date for closure?
I'd have to,
what was the assumption?
From engineering. 2084.
2084. So you're only projecting you have only 64 more years of capacity, is that correct? And that would be everything known in today's climate with the amount of acreage you own and all that?
That is correct.
Okay, so you're using 64 years, and then you have to have what available by year 64?
At that point, you need to have the adequate funding for the closure, and then you'll have 30 years.
Whatever the regs are, post-closure.
Yeah, and the post-closure maintenance monitoring.
And so that number increases in your projection here, and that's what, to keep up with inflation or to what anticipated cost of closure?
There's usually studies done where they will have engineer will come through, look, reestablish, make sure that the end date and estimated closure costs, and those get revised. I'm not sure what yours, how often you, every 5 years, and that's all fairly prescribed in the regulations on what has to happen in that period.
One other question, this chart and the previous one. So what did, you took a 3-year bite at this, and I asked this when I briefed with Doug and Steve. Were you asked, or did you take a look at what it would be spread out over 5 years, over 7 years, recognizing that some of this has some upfront, i.e. purchasing, you know, the capital equipment and the landfill module when it fits in there, and the NARS building, and I think you built $28+ million in for debt service on the NARS building. So did you look at anything else besides 3 years? Again, that's, you know, we talk about what didn't happen over the last 10 years, which was good news, but now we're going to compress all this into 3 years.
We just looked at spreading over 3 years, and at this point, I mean, the model is set. We can do whatever we need to do.
You have
that
the
was
ability to do that fairly quickly by plugging in numbers, and obviously it may change people's expectations about when they could deliver certain aspects of what's contemplated here, but it just seemed like to me 3 years was a very short window, and I was just wondering if you looked at anything else. But you have the ability to do that, obviously.
The model can do that.
The model could do it. Okay, thank you.
And then this is the final slide that shows the current rates and the proposed rates as presented. And I think also to bear in mind, not all agencies have addressed the recycling markets yet. There's a lot that are still in process, as well as I always caution people on comparisons. If they are, you know, municipally operated, if they've contracted out, if they're where they go for disposal, there's a lot of variables, and I understand that what the ratepayers see are this. So we do a lot of rate surveys. It's just that there's a lot of variables as you're looking at them. And that's my final slide.
Great, thank you. Any comments, questions? Supervisor Peters?
I was pretty astounded at the big jump in the rates, and wondered something like what you were just talking about. Is there a way to smooth this out over a longer period of time rather than this huge increase?
You know, the challenge you have on that is when you stretch things out over time, you know, sometimes if you need that, you know, 100,000 each year, if I'm going to spread it out, I've got to lower, and then I've got to either make it up to get there, or we use fund balance in the middle, which then affects the overall fund balance. You know, it's really, you know, the variety of ways of looking at it, but I just want to caution that, yes, you could spread it out over, but it might take us longer to get to the end number that we need to get to.
Yes, but you said
but it can do it.
You already had it set up, and
it can happen. Yeah, I mean, it's not.
But did you bring any examples of what it would be like if we spread it to 5 years or 7 years? Doug, you did.
That was the handout that you had at the very beginning of the meeting.
Maybe somebody can put it up on the screen.
It's a 3-year, but we gave you different scenarios. So the top number there is proposed monthly rates at $23.55 going to $36.22. If we were to go to achieve the fund balance that we've calculated based on net receivables, we would, the second line there, we would go up to $42.18, which would be an $18.63 increase. We clearly didn't think that was a prudent thing to do, but that would fully fund our reserve balances per our receivables. If you looked at the three-phase increase, we picked the number of $6.02 over the 3-year period, and you can see what the net ending fund balance is. We use $18 million in the first year, but we end up with about $20 million reserve balance. And if you compare that above, so if our target is $40 million for the fund balance next year, we would only have 19 if we went with the $6. The second year, the fully funded rate would be $58 or $58
I'm sorry,
million.
can you slow down a little bit? Are you reading numbers that are are they all on this page?
Yes.
Well,
Could you maybe put it up, I'm with you, so maybe go up there and point it out, or you can kind of do it on the overhead.
Talking about fund balance, over to the right there. Okay.
Yep.
Can we have the overhead, please?
Is there a way of blowing that up?
Yeah, we will. It's sensitive.
Thank you, this is much better. Pull it down this way.
Making me seasick.
That's okay, this is where I want to concentrate.
Make it bigger. Okay, bigger.
Okay. This top line is our proposed rates.
Pull the microphone over so we can hear you, please.
Sorry. We're currently at 2355. If we went with the proposed rate increase, that would take us to 3622. If you look over to the right, that would leave us a $29 million reserve balance, operating balance, $35 the next year and $31 the third year out. We put in the next line down, which is the target to achieve the total fund balance. And this is based off of looking at our receivables, how often we get reimbursed for our invoicing. And so under this scenario, we would be requesting an $18.63 rate increase. And clearly we thought that was not a great idea. It does have similar increases in the next 2 years, but it shows that we fully fund the reserve balance at $40 million the next year, $58 the year after, and $65 the third year. Clearly, we thought the $19 was way too much money to do this. So we looked at, and this is partially driven by our meeting with Mr. Natoli, we said, okay, what about a $6 increase? A $6.02 increase would give us, we would use $18 million of reserve. That would leave us $19 million. It would leave us 22 the next year and 19 the third year. And if you compare these three numbers here with our target reserves, you'll see that this is half of where our target would be. This is less than half, and this is a third, 40%. So then we looked at it and said, okay, if we try and average it more and we say it's $7 per month, we would come up to $30.54. And you would have a $23 million reserve, a 31 and a 31, which is still about half of what the desired is. But it's not quite as good as this line with the current. So remember, I talked about in the beginning a balance. And so part of what we're trying to do is have enough reserve balances and a good balance sheet and good financials and rate package so that when we go to the finance market this fall to fund the new organics building, that we'll get a favorable rate, because ultimately that will be part of our rate package going forward. If our reserve balances are too low, obviously our borrowing costs are going to be higher. And that's where I started out by talking about the balance of what we're trying to accomplish.
Okay. I would like to see what a favorable interest rate is on the building, how that affects your reserves.
Okay.
Based on this, I'd like to see it phased in over 3 years, but I don't think we have all the numbers on that same page to be able to find out what it will cost us to do that?
Based on the timing of our presentation, we did get Colin Bettis and Britt Ferguson to arrange a meeting with the county finance consultants. We went through the proposal of what we need to do with $35 million for the building, the purchase of 30 refuse trucks this year, some partly for 1383, partly for replacements. They gave us they liked our balance sheet, they like our financial position, they like the idea that we can go and adjust rates if we need to. They haven't done a lot of waste management company. They have done a lot more water projects. But they didn't have any problem with what we're trying to do with building. They did not, however, give us...
The total cost of the building is $35 million?
We're projecting $35 million.
I mean, a 1% difference there, I can't believe this much. I mean, that's, I guess, what I'm asking you is how much would it go up, what percentage? And so what would then the total expense be to, anybody got a calculator?
They didn't give us any numbers.
Okay.
Tepa, what's in the financing cost for the building?
It'll be hard to estimate because...
Can you come to the microphone, please?
Sorry. This is Tepa Banda. He's been with us about a year. He's our Chief Finance and Admin Officer.
So we didn't do that sensitivity analysis. The project at NARS is just a small component of our total fund balance. The fund balance we're looking at here is for the whole enterprise, which is our collections and KIFA and NARS. So yes, the dollars would be less, but there are two sides to selling bonds. There's the cost itself, which is the interest rates, right, and the demand for it. So if our financials don't look good, our interest rate might be really high because there won't be so much demand, and it's hard to estimate where that will be. So no, we don't have any concrete numbers. But it's really advisable to position ourselves in the best strength as possible, and having a fair fund balance that shows that we're pricing our risk on our revenues is a good strategy. So, but it's very difficult to estimate what interest discount we would get if our fund balance was different by 5 million or 10 million. It would be very speculative at this point. Does that answer the question? Maybe not satisfactory, but it's very difficult to project interest rates and the sensitivity on our fund balance. But
yeah, I understand that, particularly right now with the stock market, what's going on there. But I mean, are we talking about a 20% difference? I mean, is it going to be a 25% interest rate compared to a 3% interest rate? I mean,
What's the spread of the hypotheticals, right?
Yeah.
It might be 1%, which is 100 basis points or something like that.
Okay.
Yeah.
Which finance guys don't like, but public servants might.
Yeah.
Thank you.
All right, thanks.
So, it looks like 3-year phased increase is the least favorable to your position, would you say?
That's $6.02?
Uh-huh.
Or the $6.99? The $6.99 is the least favorable to the fund balance, yes.
So, okay.
602. Is that what I thought that's what I said. Oh, I'm sorry. 602.
Supervisor Tully.
Yeah, just to follow on though, I still would like to see a 5-year projection. Thank you for, doing the workup. Obviously, you're much more sensitive and closer to, timing on some of this. But if in fact Kiefer's asset, could you stand alone and borrow against it? You calculate tonnage. Another thing is if you don't fill the module up as quickly, obviously you don't have the same income coming in, but you don't bear the expense on the capital side. And I just say I think we were a little light on that analysis. Maybe it's all built in there. And again, I don't expect you to know all the history behind it either. But it seems to me that the way this was or it's being portrayed is that, well, we got these big sunk costs and, we need to have for closure and post-closure under state law. And we got to have a wetlands preserve fund that's doubled in the amount and so forth and so on. But that, if it's an asset and it generates revenue, then I guess I'd like to see, and again, I'll just be very, very blunt about it. I'm not prepared to move this forward today to a 218 process. Maybe the majority of this board is, but I'd like to see the 5-year analysis. I'd like to see some more background about Kiefer and how it factors into that, and if there are different ways to manage that asset. Again, we want to be open to the marketplace. Tonnage means dollars coming through, but it also means chewing up the capacity quicker. And and so that's an offset that may be clearly, Doug, one that's a net zero or actually a loser. I also, behind the analysis, and again, it's not all for you, but our finance folks that you've been talking with, see what a return of the franchising for the solid waste authority function is coming back to us, what that would mean to offset some of the rates going forward. That's a board decision starting in the realm. That was part of the argument about bringing it back here. And even the street sweeping part of it, I don't disagree that that's an important component, but we added that a few years ago and we left a lot of money on the table as far as I'm concerned with the contract. That's coming up in 2021, and maybe this is the time we start looking at not just the aspect of what that is, but to how that's allocated. And if we get more money coming in SB1 or some other source, again, we're now putting that on the backs of the residential collection component in large part. And yes, there's a benefit to our neighborhoods and our communities. It makes for cleaner streets. But it seems to me that some of that information, again, not to give you a bunch of busy work, and maybe there's comfort in this board, but I got to imagine the reaction of folks, even with the $7. I mean, it's pretty clever that you can do it $6.99. That sounds better than $7, but $7 a year over 3 years still gets to $21. And I just, and I appreciate the service equation there. If you do weekly pickup, that's part of the cost, but also it would mean that you wouldn't fill the cans up as quickly. So I would just acknowledge that. But and you're going to try to do some very compressed time frame, the 45 days. You're asking for that authority to go out there and try to have this by July 1st. Again, I get your sense of urgency, and that's your job, and lead time for some of this. But before we embark, and even to the next item we'll talk about in a moment, spending another $500,000 or $460,000 on architecture for the building, until we kind of have some of the things that were asked about by Supervisor Peters and so forth. Maybe she's satisfied with the answer, but I'd like to know if there are different ways to finance, to leverage the asset that we have, and not hit the residential customers, and certainly our business folks as well. But I just think the sensitivities here, in light of what everybody's being hit with, everywhere. You can't go anywhere without some other fee going up. I just think that we're trying to comply with state law, but we've got to look at it, spreading this thing out. And if I could, one question to Mr. Hartwig. So, can we have information for the next time this comes before us, whether or not we go ahead today, on where that water rate issue is pending? Because we used to see the charts about what the projections were for garbage, water, and sewer, and we used to get those annually. So we'd have this comparison as we went into rate increases, and that was a significant potential increase, not before us today, but it's relevant because it's the same customers.
In some respects, yeah, same customers, but the water rate concern is focused on a specific part of the zone. So that's something that we can get, but it's not quite as widespread as the solid waste rate and where that applies. So we don't serve water in the entire unincorporated county, so it's a variable for those customers that are served both water and waste pickup by the county.
And sewer, by the agency, the sewer. Right. And I get it, but we've spent those costs in the past, and that's a discussion that we're going to have before this board, we'll probably, within the next couple of years that relates to how we're going to finance our project. But I'm going to go back to the Vineyard example, where those folks, they get all three of them via this board or the boards that we sit on. So we wear all those hats. But that's the information I guess would be helpful, because I think it would inform what we're looking at potentially in light of this, the 3 years that you projected, but also what those projections are in the water rate, and we have the sewer rate. Again, we've gone through that. We've seen significant increases. We held the cost down to some degree, but which was good, but we still, we've seen market increases. And lastly, I would just say, you did an example of a Cubs bill. It was kind of generous there because it didn't really show the various aspects. I'd like to see what a potential Cubs bill would look like for a customer in the Vineyard area based upon projections and what we know today. I'd do a bi-monthly bill if it could. That would be informative. Thanks.
Supervisor Frost.
The target fund balance by 2022 is 58 million. Is that what we need to have in reserve to qualify for the bonds to build the building? You're saying this targeted fund balance, do we have to have that fund balance to, are there any other options?
There's no magic fund balance number that we have calculated. It's something that we're working with the CFO's office on because we had issues back in 2008 when we went before the board to get a rate increase. We've done a lot of things to change our operation and build up that fund balance. So we were never really asked to and really looked at seriously what that reserve balance would look like. Again, most of that we had targeted for capital. It hasn't been until recently, and we've been in discussions with the CFO's office on what our reserve balance should be. We've came up with the 40, the 58, and the 65 on the second line there, based solely on the receivables. I think it's 1.5 months of billing at Kiefer. I think it's 4 months billing on the residential, and I think NAR's 3 months. And so those revenue streams, looking at the receivable, that's how we came up with those numbers. I'm in no way saying that we have to reach we're not even projecting to try and reach those under this 3-year period. We do intend to go back and work with the CFO's office on what the fund balance really should be going forward. And to your point, Supervisor Peters, we didn't really get into that in depth with the finance people, and that's a discussion that we need to have.
So they just want prudent reserves, basically.
We wanted to give you an example of what we think the optimum reserve balance would be based on receivables as some measure against these rate scenarios.
Okay. Doesn't make a difference in what rate we're going to get on the bonding or, for this capital improvement that we have to do.
In the classes that I've been to on the financing, and I have not done one of these before, so I'm relying on the debt officer and the CFO. The stronger the balance sheet, the stronger the financials, the better the finance package you're going to get.
Thank you.
Okay. I have no one signed up to speak on this item. I think you're sensing, Doug, that there is maybe a common concern that it's a bit premature to act on this as recommended today. And I think you've gotten certainly some detail from the likes of Supervisor Peters and Supervisor Tolley in terms of some of the outstanding information they'd like to see. I think that we'd all like to see before we're asked to commit to any adjustment, needless to say, a large one. So looking to County Council, given the way this item was noticed, is there anything that prohibits us to give general direction in terms of coming back as time certain or leave it open? I'm not sure if what the pleasure is of other members of the board about if they want to do that with a specific date in mind or not, but I'd like to hear from you.
Yeah, there's no requirement to pick a date certain. That's entirely up to you.
Okay.
At this point, you just wouldn't be taking any action on the item, so it will just be either continued to a date certain or directed to staff to bring back.
Okay.
30 days, a month?
30 days? 30 days is what I'm hearing, at least from one member. Is there any
or less
disagreement with that? 30 days or less?
Or less.
It will most likely be.
the 24th.
24th agenda is pretty packed. We have a lot of items coming that day. So it'll be first meeting in April.
First meeting in April?
Most likely. Flo, does that? I don't think we have.
April.
Yeah.
Yeah, March 24th is full. April.
24th, we have the African American Black child, and we have other items related to that.
Okay.
So that'll push us to an effective date, I believe, earliest would be August 1st.
Okay.
With the timing.
Okay. Is there general agreement then to that date? Any nodding heads. All right. So then we'll bring this back on April 4th, was it?
7th, I think.
7th?
April 7th.
April 7th, all right. We don't need a motion, do we? No.
We
okay.
do. Oh, we need a motion
Yeah.
to continue.
We do need a
yes.
motion to continue.
Yes.
Okay, it's been moved. Chair will second. Please vote.
Unanimous vote.
Okay. Thank you.
Thank you very much for your time.
Thanks.
Thank you.
Okay, so now we're down to the county executive comments.
No comment.
Oh, I'm sorry. I stand corrected. You have item 7 from the consent.
Oh, yes, yeah, we did.
Right.
Yeah.
Okay, so item 7 is the contract to approve the Second Amendment to the agreement with Stantec Architecture for professional design services on North Area Recovery Station, the Master Plan Improvements Phase 1. This is the project to increase the contract authority from $250,000 to $667,095.
Okay.
Why does it say that it's in my district?
We can check on that.
Because it's the one in North Highlands?
Yes.
It seems like a whole board kind of issue, but okay.
Oh, we'll make that change.
I think this ought to come back after we approve the item that we just moved.
I agree.
Okay. I think you're getting concurrence on that. So do you want to, is that a motion?
That move to continue to the to April
7th?
7th,
Okay, Chair will second. Please vote.
after this item.
Correct.
Understood.
Unanimous vote.
Okay. And we already heard that the CEO does not have any comments. Members of the board have any comments? I know we have an adjournment. Okay, seeing none. Supervisor Kennedy?
Thank you, Mr. Chair. I'd like the board to adjourn today in memory of Patrick Malarkey. Patrick passed away on February 25th at the age of 88. Patrick was raised in Sacramento. He graduated from Christian Brothers High School and Sacramento State, but I've never held that against him. His family came here from Ireland in the 19th century. I've never held that against him either. Patrick was Sacramento County Supervisor from 1971 to 1978. He was a very successful dentist and bar owner. Many fond memories of Malarkey's.
Wait, you remember them?
Yeah.
I don't remember mine.
Me and my fake ID. He's remembered in Sacramento for his countless contributions to his hometown as a member of the Board of Supervisors and his generosity to those in need. It's not well known, but Patrick actually, as a dentist, would, without even talking about it, just do it. He would go out and help people with free dentistry when they could not afford it. He volunteered his dental services for St. Patrick's Home for Children on Franklin Boulevard, and weekends he dedicated to helping particularly children for free many times. And he'll be well known in District 2 and the county as a whole for his generosity and his larger than life self. So I'd like to adjourn this meeting in the memory of Patrick Malarkey, and he would insist that I also adjourn it in the memory of the Alhambra Theater.
Very good. Very good. Okay, so if there's no further business before this board, we will adjourn in the memory of the late Supervisor Patrick Malarkey and the Alhambra Theater that was so beloved by him.